by the general population for services, and this is reflected in the numbers and the types of services offered by the psychiatric hospital, the polyclinics, and the outpatient clinics that are associated with mental health. The only thing now, well, the one major thing that we were not able to achieve, and we are going to be doing this in the next financial year, is amendments to the Mental Health Act and National Mental Health Policy, which we would articulate in time to come. I now move to vector control. And vector control is important, obviously. It's important because not only are we fighting COVID, but we are also trying to manage dengue, because we've seen several incidents of dengue in this country, as has happened in the region and throughout the world. And as a result of that, we have initiated an integrated mosquito management program back in December, and we were able to employ 40 mosquito control aides, and the department has been awaiting some equipment to arrive on island, which I'm very happy to say that the equipment has finally arrived, equipment that was donated or is being donated by PAHO, as well as equipment that has been purchased by the Ministry of Health and Wellness. This equipment includes several handheld foggers, as well as some vehicle-mounted foggers that will allow us to be able to deploy 4 vehicle-mounted foggers throughout the country, 2 in the northern half and 2 in the southern half, along with the handheld foggers, and also the personnel who will be trying to identify mosquito breeding sites so that we can really address this problem. I also want to say at this time that going forward, there's a project under discussion which has to do with the eradication of the Aedes aegypti mosquito, and it is also a revenue generating project, which I'm sure that the Prime Minister will speak to in the coming days or weeks, because it's a developmental project as well. We also have the insectary in a box, which is located at the Graham Hall, and that has been impacted to some extent by COVID, but they have been able to, the persons working there, to determine species of mosquitoes on island, which has really been very, very helpful to us. And from May 2021, the next financial year, they will start the insecticide resistance testing. And this is going to be very important because you and I know that somehow mosquitoes have gotten very used to BOP and Baygon and those insecticides. And so this initiative will allow us to be able to develop some other things that will be more harmful to the mosquitoes on island. I come next to the Best Dos Santos Public Health Laboratory, which is part of the primary healthcare system. This lab, as you know, would have done a tremendous job, even with the challenges facing the lab from time to time throughout COVID. But the lab, like the ministry, is more than COVID. The lab has been doing a lot of outstanding work over the years, and we've been able to provide additional machines for the lab. And for example, the lab started a program, a joint initiative with PAHO and the government of the Republic of Argentina, dealing with antimicrobial resistance. And this, although things have slowed down in recent times, the intent is to start in the new financial year and to get things going in the direction that we want them to go. Antimicrobial resistance occurs when things like bacteria and viruses and parasites change over time and are no longer responsive to medicines, making infections harder to treat and increasing the risk of disease spread, severe illnesses, and death. And that is why this is really very important to us. And it is equally important also because our Prime Minister happens to be co-chair of a World Health Organization subcommittee dealing with this very subject. And this is something that really will take us a long way into the future to arrive at the destination that we want to arrive at. There's also, in this coming financial year, going to be an initiative, and I'm not going to speak much to it today because that is something really for the Ministry of Finance, Economic Affairs and Investment because of the nature of the project. But I can say to you that it is intended that this lab will not only be a lab doing tests and so on, but this lab has to go into the area of research and development. And we are moving swiftly in that direction. And also to give this country the capacity to be able to do genomic testing, which is vitally required at this time and even beyond COVID. And you will hear more about this as time goes by. The refurbishment of aging and dilapidated healthcare structures. This has been a problem affecting the Ministry of Health and Wellness and the Queen Elizabeth Hospital for many years. And when I assumed office as Minister of Health and Wellness, this was one area that I said to myself that through my tenure as minister, throughout my tenure, I will do everything possible to make sure that we refurbish as much of the structure, the infrastructure as we possibly can. And so during this current year, we've had problems where several of our institutions have been plagued with environmental and structural issues. And we embarked on a program, thanks to the Permanent Secretary and the Financial Controller, who've been able to squeeze some funding for us to be able to do one or two things. And I will mention those now because they're important. The Albert C. Graham Center, for example, that was offline for a while. Why? Because we had to replace a roof over the assessment area of that facility. And we had to do a lot of interior and exterior work, including retiling, rewiring, and upgrading of telephone and internet services. In addition, the pool was also down for a while, out of commission, and this pool was used really by the physiotherapy department. And we were able to refurbish that pool and put it back into operation with assistance from the Maria Holder Memorial Trust. The education unit and workshops, they were also refurbished thanks to First Caribbean International Bank. And we had a generous donation from a former parent, or rather parent of a former client of the center, which was used to purchase new equipment for the physiotherapy department. And I'm really, really happy that we were able to do that because that is the premier institution for those children, and really and truly, we really felt that we needed to provide the very best of facilities for those dear children. The St. Philip District Hospital also saw some renovations. We had one ward that was out of commission for a while, and that was completely refurbished, which then increased the capacity by 16 additional beds. And as you know, we have some serious issues in this country with care of the elderly and providing facilities for these dear persons. We were able to completely refurbish the St. Lucie District Hospital, which is being used as a quarantine facility, but this will be returned to the healthcare system to provide for the elderly.
Remember, we're inviting you to wrap up
in
shortly.
time to come. And the Queen Elizabeth Hospital has also been doing some excellent things down there. I see health is so big, and we've done so many things that I really had to explain these things. Anyway, the Accident and Emergency Project, which is going to be the new Accident and Emergency Department, is earmarked for opening within the second week of April next month, next financial year. And that is going to provide a lot of additional capacity for the QAH and for the people of Barbados. That facility is at 9,000 square feet, and it will have a lot of new things associated with it, and the QAH will speak to those things when they get the opportunity to be able to. And to wrap up this segment of it, I want to say that I'm really pleased with the work that has been done by this team to provide for the people of Barbados outside and beyond the confines of the COVID pandemic in challenging times and situations, but they have demonstrated beyond a shadow of doubt that no matter what comes our way, there shall be no retreat and there shall be no surrender.
Thank you, Minister. Please move the head with amendment.
I beg to move, Madam Chair, that head 86 as amended, the tune of $252 million stand par.
Honorable Leader of the Opposition.
Thank you very much, Madam Chair. I am sure that your liberality with respect to time allowed the Minister for that presentation, which is 3 times the allocated amount of time, is not because of your being a medical professional yourself and therefore having a high degree of empathy for the Minister of Health, but because you also appreciate the importance of the role of this ministry at all times, and especially so at this time. And I want to begin, as I have not begun thus far in my initial submissions. I want to compliment this minister for the significant role he has played in leading the fight in the face of the current health threat to the nation. I want to commend him on his disposition and his deportment and his sense of duty. I am sure going to the length of personal sacrifice and maybe even risk of his own health in so doing. The members on the other side, when they have spoken, they have started with compliments and commendation to every single minister. I didn't, not because I don't think others are worthy of it, but I do so in this case because I think this particular minister is significantly so worthy of it, and I want to commend him, and I want to commend the team that is present here with him, and certainly in a very personal way on behalf of my family, constituents which I represent. I want to express appreciation to the medical professional staff in Barbados. I hail the talent which we obviously have in this sector in Barbados, and I feel that the nation owes a high level of debt and gratitude to them beyond our capacity to pay now or ever. And I say that very sincerely, and I know we have to enter into a discussion here, and I have to raise 1 or 2 questions for which I think Barbadians would want answers. But I want to begin by commending this minister and his team and the wider health professional community, medical services community in Barbados for standing in the gap for this country in its hour of dire need. Now, ma'am, one of the strategic objectives listed in the estimates document with the figures, this is the estimates of expenditure for the oncoming year. At point 7 on the strategic goals is the aim to develop a health financing strategy for Barbados. To develop a health financing strategy for Barbados, and that is where I would like to begin my focus. And perhaps the minister is not necessarily the individual to respond. He can decide, but he's spoken a while, but certainly there must be those who are given to the practice of health-related economics and planning who may particularly so be interested in being first responders. Now, whether this government constitutes the next administration after the next several months in Barbados or not, the problems that the challenges that we now face will still be in front of us. And whoever constitutes the government has to be properly positioned or prepared to be properly positioned to address these significant challenges. In point 7 of the strategic objectives of the Ministry of Health, as indicated in this document, is a recognition of that. that we are going to have to respond to the challenge and answer the question as to how we plan to finance health services in Barbados going forward. The current model is not sustainable. The current model will not take us where we need to go. The current model is not properly addressing the immediate problems in the health sector and health of Barbados that we now face, and is not likely to be viable in the face of new challenges which will come. The same has to do with education, so it's not just health. Already it is beginning to emerge, despite this party's platform on subsidizing education costs at the tertiary level. Already it is beginning to emerge that there are some strong currents of feeling that that model of providing tertiary level education in Barbados has to be changed. It will be interesting to see where we as a country go on that. But education, health, human welfare services, housing, even, Madam Chair, building climate change impact resilience. These are going to be serious challenges for any government. This government right now is constructing a survivalist platform rather than a growth platform. And in the absence of a growth platform, and constrained as we are in terms of generating, using the historical models, revenues to support these services, then the government, this government, since it holds the office today, and by constitution does for another 2 years or so, should be in a position to tell us how it plans to finance these things. But we are particularly focused today on healthcare and wellness services in Barbados. How do we strategically plan to finance that in keeping with objective number 7? I've said before, it is my view still, with respect to health in Barbados, we are confronted by the perfect storm. We have the incapacity of the state to subsidize fully and properly healthcare services in Barbados in a context where we can't generate revenue, even with respect to the COVID situation. One understands this. There's had to be significant recourse to borrowings and grant funding, but that is understandable. But outside of that, we are not in a position right now to generate the kind of revenues necessary, and therefore the incapacity to fund wellness and medical and health services in Barbados is a challenge. As part of that storm, the country's demographic profile, where we are admittedly and obviously an aging population, the disease profile with respect to NCDs, as was mentioned by the minister himself, the lag in technology, the equipment deficiency, the aging plants and infrastructure to which the minister himself referred, nursing shortages, despite our best efforts, the culture around the provision of consultancy services, especially at the QEH, the rising cost of living across the society, and the cost to provide health care in private circles, and also the high level of demand for healthcare services by our non-resident population among us. All of these constitute what I consider to be a perfect storm. How does Barbados finance healthcare in that context, in keeping with strategic goal number 7? We certainly will have to transform the health profile of our population. The minister alluded to that, especially with reference to NCDs, but there are others dynamics as well. How do we counter the cost of what is called out-of-pocket care that people must seek, even in the context of public service provision of care? You go to the hospital and service is free, but then the other aspects of your treatment and care, medication that have to be paid for, that comes out of pocket, and it's rising. And if you have to make resort to the private care services, that cost is becoming astronomical in some cases. How are we going to derive efficiencies in a system which often still is the subject of political influence and the subject of, well, less than ethical behavior? And do we contemplate the introduction of some form of national health insurance to treat to this? And if we do, what would be the basis for that? these are some of the concerns that I would think we have to be involved with as a country as we seek to develop and grow, and the health profile of the country significantly. The health platform upon which we operate is significant. I'll pause for now, but those are my opening comments, ma'am.
Thank you, Honorable Leader of the Opposition. Well, the aspect of your opening statement, which I will deal with, has, well, you spoke about healthcare financing, which is absolutely true in terms of our estimates of expenditure. And I want to report that the first step in that direction has been completed, which is the costing study, which was done throughout this financial year. The costing study, as you would recall, would have been done by the Health Economics Unit of the University of the West Indies, St. Augustine, Professor Theodore. We would have employed a healthcare commissioner to assist in this process. Those reports are in, those studies are in. We've had some discussions, preliminary discussions at Cabinet. The studies have been very, very informative, to be honest with you, when we were able to compare the cost of the provision of services, for example, at QE8 with comparable services in the private sector. And we were able to see even within the polyclinics where we could make some changes that are necessary in relation to where the polyclinics that offer certain services in a greater catchment area and are doing more in that regard than other polyclinics, so we can rationalize services in polyclinics as well. But that study has not yet been completed. The review that is by Cabinet, and we shall move swiftly to have that done in the new financial year. Regrettably, we slowed down, and I apologize for that at the ministry, because we obviously would have been focused on COVID, but this is one thing that we will pick back up. And obviously the Ministry of Finance, Economic Affairs will also have a say in this, but we'll be moving swiftly to healthcare financing in the new financial year.
I was hoping that beyond the minister, and thank him for the response, we would have had a little bit more from perhaps those who are more technically proficient, those who are more immediately concerned with health planning and the economics related to the health provision. I will still wait during the course of the debate to hear some more of that. I do not know the extent to which. I know it is, according to the minister, a costing study has been completed, is now the subject of Cabinet review. I do not know if there's any aspect of that it would be proper to speak specifically to, beyond simply telling us that the study was completed and is now being reviewed. Is there anything of significance that it would be appropriate to mention to us? At the level of the World Health Organization, I think it would suggest that there's failure in your health services system if the cost of providing curative care too far or far exceeds the cost of providing for primary health preventative care. Do not know what the reality is in Barbados. Does it cost us exceedingly more to provide the curative care and at this stage than it is costing us in terms of our own realities or our planning with respect to preventative care, primary level preventative care? I don't want to prolong the moment, but I do think that financing healthcare listed as a strategic goal is significantly important. And if we can't have anything with reference to the study reviewed to us at this time because it's inappropriate, what is the assessment with respect to the relationship between the costs associated with providing curative care and treatment as opposed to preventative primary care?
Thank you, Honorable Opposition Leader. I have shared two aspects of the costing study with you, and regrettably, I cannot go any further because this is a matter that has not been fully reviewed, as I indicated, by Cabinet. But this is what I can say to you, Honorable Member. Even before the costing study started, From the beginning of my tenure as Minister of Health and Wellness, the ministry embarked in collaboration with the Queen Elizabeth Hospital on some projects that would reduce the need for curative interventions and also reduce the costs of services. The 24-hour polyclinic, for example, the 24-hour service at Winston Scott is one of those because persons had to spend out-of-pocket expenditure, as you indicated, to go into private facilities because accident and emergency was the only thing available at that time. The Queen Elizabeth Hospital, and I'll hand over to the executive chair, they've been doing some work as well in relation to NCDs and introducing one or two initiatives that will significantly reduce the costs at their end over time. And we've also been doing work with the elderly care, the elderly program, the alternative care, the elderly, for example, which the ministry embarked on a few years ago, and that is continuing because we recognize that the cost of care, the institutional cost of care, for example, at geriatric hospital, and even within the QEH, where we're still seeing some elderly for care patients, that we can have some significant savings by going into communities and the community programs which we have embarked on in collaboration with the Ministry of People Empowerment and Elderly Affairs. Those are programs that are aimed to reduce the cost of health care in Barbados. But I'll invite the Queen Elizabeth Hospital to speak.
Thank you very much, Honorable Leader of the Opposition. Very important observations that really speak to the sustainability of the health system going forward. So thank you for your interest and your remarks. You are correct that the cost of services across the entire health system are in need of significant rationalization. And as the Minister would have spoken to, we have tackled a few areas where we recognize that we are leaking some areas of costs. The Community Health Workers Project that would have been initiated within the last financial year recognizes that for many people who are confronting chronic non-communicable diseases, specifically diabetes, heart disease, and who are vulnerable, they are very often finding themselves in the accident and emergency room, facing significant readmission, and it means that we have to strengthen what we were doing at the community level. Normally, as you indicated, Honorable Leader of the Opposition, the primary healthcare system plays a significant role in preventative care and working with persons who are located at home. But increasingly, hospital systems globally and here in Barbados have recognized the need to do outreach from the hospital into the community with a view of keeping people at home, having access to physicians, having access to specialist care at the hospital, and thereby reduce the readmission rates. We've also recognized that these kinds of initiatives are able to help us save the cost of a readmission, the cost of visits to the accident and emergency room, but more importantly, beyond cost, improves the quality of care that people are able to access within their homes and the support that is available to families. We've started initially with 250 patients who are now in our program, and we're targeting in the next financial year to increase that to a further, by 250 to 500 persons. And that should significantly impact or the cost of inpatient admissions, which has been highlighted by the costing study. There are other areas where we have also sought to achieve efficiencies, recognizing that the Public Finance Management Act and the national policy, along with the very real financial constraints facing the government, we have had to identify very specific areas where we've had to make interventions as an hospital to achieve efficiency gains. And if given the opportunity, I can speak to those areas.
Thank you. Honorable Member for St. Michael, South Central.
Thank you, Madam Chair. I have two questions. Let me first say, I'm sure every member who speaks will do this, and I apologize, but I have to congratulate the Minister and the team here with him for the tremendous work that they've done. Not just, and let me salute not just the medical, clinical staff, but also the lab staff, the operations and the administrative teams of the Ministry of Health and Wellness, of the QEH, and all of the facilities that have, in short order, gone up to take care of Barbadian people. I think sometimes we don't realize that there are many behind the scenes who make it happen, and I want to salute everyone there in the room and all the other team members. Let me, if you allow me, I will ask one question and then have the answer and then ask the second. I'm conscious that, Minister, this is a 1 in 100 unprecedented tension and competition for healthcare resources in this country. You have had to save lives and help protect livelihoods while at the same time having to do the general work of the healthcare system. People don't, the other issues, medical issues that confront people didn't stop because we got COVID. And this kind of competition for resources has never been seen in the lifetime of anybody in this honorable chamber. We heard earlier about the notion of a survivalist platform versus a growth platform. If you don't live, you can't grow. And I think that what we are realizing is the tremendous job that you're doing in making sure that there is any kind of platform on which this country can go forward. That being said, it is the case that there are other competing issues and other challenges that also relate to COVID. And one of them has to do with your program 360, Primary Healthcare Services, and that sub-program 365, which is your nutrition services. You have non-statutory recurrent here of about 216, almost 217,000 Barbados dollars. Now, I'm concerned about nutrition in the country as it relates to health and wellness. We talk a lot in the context of COVID about food security. I'm concerned, Minister, about nutrition security. I think that we have to make sure not only that people have enough calories to keep their bodies alive, but what is the quality of those calories? We in the Ministry of Finance, Economic Affairs and Investment certainly have our own contribution to make in terms of ensuring nutrition security and the affordability of that for the population. But I'm wondering, and hearing the conversation earlier about health finance, I'm wondering whether we don't need to invest more and invest across ministries, not just in the Ministry of Health and Wellness, but whether we don't need to invest more in nutrition, making sure that people understand how to eat, have access to affordable food. The executive chair spoke earlier about some of the preventative measures, but I want to hear more about what we're doing beyond this 217,000 Barbados dollars to address that issue of nutrition security for the population.
Thank you, Honorable Member. It's a very interesting question that you have posed, and I will invite the CMO to speak, but before I do so, the nutrition policy that we've been trying to develop, and we started with the child nutrition policy first, and I would have indicated that we're going to the next level in the coming financial year. These two initiatives really provide the platform on which we will build going forward. Because one of the things, and yes, funding is very important in this respect, but we believe that a serious educational program is necessary in this country at this time if we are going to change eating habits and influence people in that way. And we wanted really to start with our children because we know the situation with childhood obesity, and start with our schools. And that is where we are going right now, but I will ask the Chief Medical Officer, who I know has been working with Dr. Arthur Phillips, along with the stakeholders on this nutrition initiative.
Thank you so much. With respect to nutrition security, these issues are broader than healthcare and will require an approach that embraces agriculture.
Dr. George, sorry, I know you, but for the purposes of our records, could you introduce yourself, name and post?
Thank you so much. Kenneth George, CMO.
Thanks.
As I said, nutrition security, the fundamentals of nutrition security frequently lie outside the typical healthcare sector. And therefore, I would encourage, based on the comments of the Honorable Minister, that a team involving agriculture and commerce and trade be also added to the issue of nutrition security. Certainly, the Ministry of Health will be able to play its part. Traditionally, we have always concentrated on the supply side for nutrition, and we deal with nutritional content, portion size, the relationships with non-communicable disease, etc. But when we speak of security, those tend to involve issues surrounding the ability of a nation to provide health and wellness for its people. And therefore, these other agencies will be required. We have had good relationships with the Ministry of Education, Technological and Vocational Training, and they have endorsed our program with respect to nutrition in schools and the current policy which we are going to roll out. This will require a collaborative effort because we will provide the technical expertise, but we certainly believe that to make an impact on nutrition in Barbados, that this will have to be a school-based approach. As the Minister has indicated, schools are out, and we certainly believe that the school meals program has a lot to do with nutrition security and safety. So these are points that should be considered in moving forward. Thank you so much.
Thank you.
Thank you very much. You know, as I mentioned, we're not in a normal environment when it comes to the kinds of health expenditures that we can choose. Before COVID, we had lots of discussion about the kinds of encouragement that we can give to individuals to be compliant in their care of NTDs, to eat the right foods, to move their bodies, to do the right things. And I still think that there's scope in the health financing plan to look at how we can invest prior to it becoming an issue, invest in people's health care by providing certain kinds of encouragement. There's a word that I'm avoiding using, but providing certain kinds of encouragement to people to manage their health. And I think that once we are past the worst of the pandemic, that this might be something that we can look at. On a related question, I believe, and Minister, I think you mentioned it in your opening, but last time we were in this place on this matter with the Ministry of Health and Wellness, I raised the question of cancer care. And I am very pleased to see the movement that has been made. I mean, talk about being able to walk and chew gum. The Ministry of Health and Wellness has really distinguished itself in managing a pandemic and still advancing the transformational agenda of the country. I'm happy to see that there has been movement in terms of having a cancer care plan. I would like to hear a bit, though, about implementation. I confess that I'm not sure on where in the 21-22 estimates We are capturing implementation. I'm sure that because it is in the operational expenses of the Queen Elizabeth Hospital, it is a little bit, it is not spelt out in the estimates because what we see is a single transfer to the Queen Elizabeth Hospital. But we do have many challenges with different types of cancer. Barbados actually has some incidence rates that that make it stand out for the wrong reasons when it comes to women's cancers and other types. I'm concerned not just about the preventative measures, but also about the level of care, access to drugs, access to different kinds of treatment protocols. Tell us a bit, please, about implementation of the cancer care plan that the Ministry of Health and Wellness will be rolling out in the coming months and years.
Thank you very much. I will invite the Chief Medical Officer, and I believe the QAH would also be involved in providing the information. Thank you.
Thanks again. The cancer plan has a primary health care approach. The plan looks at ways of prevention of cancer in Barbados, noting that the cancers of public health significance are prostate, breast, cervical, and colon. I am happy to report that the incidence of cervical cancer in Barbados is falling, and that is a good, that is very good for the population. However, our concern continues to be with breast cancer, which our rates have shown an increase. We believe that a fundamental preventative program is important, along with good therapeutics and interventions for cancer. So the fundamentals of the plan involve what can individuals do to protect themselves, and if they have cancer, to present to healthcare services early. Therefore, the plan builds on a lot of partnerships, including that with the private sector. So, for example, the Barbados Cancer Society, and where individuals will receive cancer care. There are other NGOs which support our program, and these NGOs offer at low cost the ability of persons to have screening and early diagnostic care. So the cancer plan is built on a model of prevention. It does look forward to the technological advancements with respect to delivery of cancer services in the hospital. You're quite aware that the issues surrounding the nuclear accelerator and other modalities of treatment, but we firmly believe that a lot of the emphasis, as mentioned before, needs to be in a primary and preventative approach. And let me take this opportunity to encourage Barbadians here that there are guidelines for monitoring and making decisions if you are will be afflicted by cancer. For example, prostate, breast, and simple plans of what to do and what basic screening methods you will need to protect yourselves. And I think that's where it starts. Thank you so much.
Thank you, CMO, and thank you, Honorable Member of Parliament, Minister Cadell. You're correct that part of the cancer plan referred to by the CMO involves significant emphasis on the area of screening. The only way in which we're going to be able to make the level of impact that is envisaged and provide the quality of care is if we're able to capture as many people who need the services. The Queen Elizabeth Hospital plays an important role in both screening and treatment for cancers. We receive a significant amount of referrals for colonoscopies, ultrasounds, and other screening associated. Recognizing that we've had waiting times associated with this, part of the estimates part of the investment that we have made in this year's estimates have been to acquire additional manpower. Right now we have 2 consultants who do colonoscopies. We have a very limited number of persons who do ultrasounds, and as a result, we've had waiting times that, in our view, are very inadequate. So this year, we have put into our estimates an additional gastroenterologist, 2 additional sonographers, an interventional radiologist, and other expertise who will help reduce those waiting times and provide additional man-hours to do the screening. We also recognize that investment in large pieces of equipment, cancer is dominated by the latest in technology. And in order to provide the Barbadian public with the kinds of treatments that are required, we need to build on what is available at the Lionel Clara Oncology Center and the investments that have been made by our dear Ambassador Rihanna Fenty. We need to complement those investments with additional private sector investment. As I understand it, the private sector is looking at building out some work in this regard. And as the minister said earlier, we are going to be having to finance or deliver services very much in partnership. This is where effective service level agreements will have to be entered into in order to provide the level of care that is envisaged. I believe Barbadians do not so much worry where they get care, whether it is in the public sector or in the private sector, but that they access care. So we've been looking at both the screening and the curative treatment side as areas that we have to specifically invest in order to give the level of implementation that you're asking for, Honorable Minister. Dr. Williams, have I missed anything? I think we've covered it all.
Thank you so much. A very quick follow-up to that. I appreciate that you're investing in screening, that you're investing in treatment. I want to ask, though, we seem to have potentially environmental factors. There's something that is causing, in particular, when I think of breast cancer and how early young Barbadian women and some men are presenting with breast cancer. So I think screening is important. I'm hoping that, as other jurisdictions have done, that we're encouraging earlier screening than used to be previously done, because it used to be that women from the age of 40 were encouraged to have screening. We're seeing high incidences in women from as young as 25, and I'm sure you have more data than I do. But I want to know whether the QEH, the Ministry of Health and Wellness, plan to invest in research that is specific to our population in this part of the world, to understand whether there are environmental, genetic, or other factors that are contributing to this high incidence. Because yes, we want early screening. We want people to know early if they, in fact, are going to have to be seeking treatment. But the fact is that if we can make even earlier interventions, because we understand why people in this part of the world seem to be more susceptible to certain cancers, then that is an even earlier and more effective intervention. Are there any plans for specific research in this?
Thank you, Honorable Member. The answer is yes, and that is part of the lab expansion project that we're working on, and I'll invite the director of the Best Dos Santos lab, Dr. Sonji Beckles, to respond.
Good morning, Honorable Minister. Sonju Beckles, Director of the Best Santos Public Health Laboratory. In terms of diagnostics and research with respect to cancer, a part of our expansion to the Best Santos includes developing an arm where more research will be done, not only for COVID, looking at the genetic markers and looking at the different strains for COVID, but also we're seeking now to address some of these same issues that you're speaking here. So one arm of it will also look into the genetics potentially associated with the cancers that are found, particularly in our people in Barbados, and we can reach out to other, or also see how it differs from that may be seen in other jurisdictions. So the development, yes, the thought and the goal, and we are working towards actually developing the capacity in-house in Barbados to be able to do some more research in this area. We are we're propelling this particular project with the assistance of some Barbadians who are actually living in Canada, in the US, who are also working on cancer diagnostics in those areas, and they're willing to help lend the expertise here in Barbados to develop our own capacity here that we can actually monitor and track and see what is actually going on in our own Barbadian public. So yes, we're working on this.
Thank you. Before we move on, I have a question with respect to the cost of the cancer therapy. For instance, I have a patient that I accessed the medication for her multiple myeloma. She was given the option of a cheaper medication or free medication, and the doctor made it clear that the more expensive one should work better, and that's difficult for a patient to hear. The cost of this medication is $3,400 for, I think, is a week's supply of it. Are there any plans to help these patients to assist in the accessing in terms of cost of this medication?
Thank you, Madam Chair. I will invite the Director of the Barbados Drug Service, Dr. Mariam Hines, to respond.
Thank you for that question, Madam Deputy Chair. I wanted to just more or less...
Mrs. Hines, just introduce yourself for our hands.
I'm sorry. My name is Mariam Hines, and I'm the Director of the Barbados Drug Service. And I would speak more on the cancer from the perspective of my other seat on the Queen Elizabeth Hospital Drug and Therapeutics Committee, where we actually look at cancer drugs for patients and more or less adjudicating and facilitating for them to be able to access those kind of drugs. Yes, there are times that we do try to use the less expensive drugs, those ones that the innovator patents are out, and we do have generics that we think are of good quality, but we have a system in place where if such generics are not working, that we will switch the patients to the brand. And that is being done through the Drug and Therapeutics Committee with the directors of the Queen Elizabeth Hospital, because whatever discussions we have or suggestions or recommendations we make, it will go up once it's over a certain amount. And I think that initially we did have some delays, but now we are able to fast track our deliberations, and if there's something urgent, that actually we would do a round robin immediately to try to see how patients can be facilitated. So yes, through the Queen Elizabeth Hospital, we have been helping, and in fact, we are also working with innovative pharmaceutical companies where they will submit proposals to us, where they would work with us, both in terms of training for physicians, for lab technicians, in terms of what diagnosis, and in terms of the testing, MRIs and whatnot, that these companies are actually going to be paying for it. And where our capacities in Barbados, for example, could be limited, they would actually take some of the samples to Colombia or the United States to do some testing for us and training. So we have been working very diligently to assist cancer patients in this regard, and plans are in place to even help even more. And I'm happy to say that cancer is not like diabetes or hypertension. There are usually few persons that are involved, because those drugs, as you said, are very, very costly. but we do make provisions. And I'm happy to say that there had not been a single cancer patient that would have come to us for assistance that we were not able to assist. We've been able to assist them in terms of making sure that, you know, they are able to access their medication. And I would also say that there are also the Cancer Support Society and the Cancer Society that do have programs in place as well to be assisting such patients. So through this forum, maybe I can advise persons that would be so affected that, you know, there is help either through the Queen Elizabeth Hospital or through the Cancer Society.
And this is something the doctors know? I mean, I would have thought that that would have been offered when that would have come up. Is this something the patient is expected to know?
There are instances where we would have advised the patients if they didn't know. But yes, because as I did mention, you know, the adjudications that take place at the Drug and Therapeutics Committee at the Queen Elizabeth Hospital, these are applications that are submitted by physicians. So most of the physicians in that area are aware and they would submit. And maybe through this forum, those who may not be aware, they would be aware that there is a cancer plan and there is support and help in terms of treatment for such patients.
Thank you, let's hope so. Honorable Member for St. Thomas.
Madam Chair, just wanted to add for for information that we actually have $1.5 million allocated in the QEH budget for specially authorized drugs such as the one you were referring to.
Honorable Member for St. Thomas.
Madam Chair, blessed good morning to your colleagues and other distinguished members in this gathering today. I want to clearly indicate my joy and satisfaction in the outstanding role that the Ministry of Health officials and others have played now that we're in the COVID pandemic. Indeed, they would have been doing excellent work before, but we know that it has taken a toll on every sector. But the Ministry of Health team, they have continued to work amidst all forms of challenges, and I thank God that they have continued to remain well. I will want to extend sympathy to the frontliner who would have lost her life earlier on, and I pray that they will continue to work assiduously to make a difference, not only looking at the doctors and the consultants and so on, but the janitors and the general workers and the others who have been a part of the entire exercise. It has been a holistic approach, and I want to commend the Honourable Minister and his distinguished team for the excellent work they've been doing. I also want, ma'am, to indicate how happy I am to hear of the National Mental Health Policy that government is looking at, and the act that is being examined to be able to make a difference. As a society, we have so many hundreds, perhaps thousands now, of individuals, not only young people, but we have a lot of homeless people, people all around Barbados who are suffering in some way, whether it be from alcohol or drugs or depression or some kind of loss. And they're on our streets, they're in the homeless facilities, and I believe that acknowledgement of knowing that we need to go this route will be very important, because a lot of Barbadians don't understand mental illness, and we treat it as though it's just one of those things. He's ridiculous, or has not cared herself, or not eaten well. They don't understand the triggers, especially now at COVID time, where people are shut away, they cannot eat, cannot do the things they're accustomed doing in the way they have been doing. And of course, our people don't read like we used to before in the household all day long. We stayed indoors, we read, we did what we had to do, but this is not our generation. And therefore, I want to commend the Honourable Minister and his team for looking so closely at this particular exercise. And I also want to commend those community-based organizations, particularly the faith-based and others, who have been working assiduously to be able to offer programs. I know that the bereavement services has been doing an excellent job, and I want to indicate to Barbadians, when you hear bereavement, it's not just that it is death, but it is some kind of loss of your property that you've paid for so long, loss of a pet that has been the only person whom you could sit and talk and chat with and so. loss of a life and employment, especially at this time. And I would therefore want to highly commend that and to indicate to the minister and his team how we are in favor of a number of things that are happening. My question, ma'am, is more so associated with the senior citizens who are our pillars of society, our nation builders. And I heard quite a bit is being done with the NCDs, and I know that the quality care of seniors within their communities is really very important now. And I'm saddened that for so many years as a society, we have not sought to look at having more gerontologists trained to be able to treat to us. You're talking a society where I believe that they say that we are the second largest in the world with so many centenarians and senior citizens living. And the longer they live, the more difficulties there will be, difficulties in the sense that the care component within the villages and their houses and wherever they are is really very important. And so I want to indicate to the minister, we have the National Development Scholarship, we have other fora through which people can go to get the training. Barbados does need more gerontologists in order to treat to our aging population. Our district hospitals are playing an excellent role as well, but the capacity is so much, and I'm so proud to have learned that this administration is looking at plans for the geriatric hospital to be relocated in the environs where there will be peace and tranquility and so on. But my big problem is every day there are requests for senior citizens to be put in the district hospital. Almost every 20 calls per day that I get, and I'm sure that other persons and other MPs and other people get them, are people asking for help to put their families in the district hospital. So we know the critical aspect of it that is playing on our limited resources. And I want to indicate or to question as to what are the plans for expansion of some of our hospitals. We have the district hospital at St. Thomas, we have the one in St. Philip, where we know what has happened in St. Lucie. But because we know that the quality care there is paramount to whatever is to happen to our seniors, and they are the most popular, I would want to hear from the team, ma'am, as to what plans there are for expansion of it, because we know that they're packed to capacity now and can take no more. And an extension is that many of them are still in the critical beds at the QEH because they have no relatives or others to look after them. That too impacts on the role that the hospital and the health sector has got to play. So if I could get in a little nutshell, please, what their plans are, I would be extremely grateful. Thank you, ma'am.
Honorable member, the plan really, yes, the government of Barbados has agreed to the construction of a new geriatric hospital, and that will be part of a complex which will include other facilities. We are looking hopefully at being able to have a palliative care center and also a national rehabilitation center in Barbados. And the new geriatric hospital, our concept of it is that this hospital will offer more services than are currently offered at the St. Michael District Hospital. However, the key here really is not the expansion of the district hospitals, but really the full implementation of the national plan at the community level. We have several persons who are trained in this country in care of the elderly, and we believe that expanding those services within communities where people are able to go in and assist elderly care persons in their own homes and in their own communities where possible, that is a better option. Not only a better option for those elderly persons who will be within familiar settings, and we're talking about persons who do not require hospitalization, because that is really the key. And we also know very well that it is more cost effective to pursue that area of care within communities than it is for institutionalized care. And that is why we believe that that is the direction to go in. We've also provided and we've expanded to some extent the alternative care of the elderly program using the private healthcare, senior healthcare institutions. So it's already a mixture of things that we're doing, but institutionalized care ought to be the last resort, and that ought to be kept for persons who really require that sort of assisted institutionalized care.
Thank you.
And the PS would like to respond. I'd like to invite PS Phillips.
Good morning, everyone. I'm Janet Phillips, the Permanent Secretary in the Ministry of Health and Wellness. Just an adjunct to what Minister was saying as well, we do want the option where persons can be cared for within their communities. That way the cost of institutionalized care is less for the ministry, but we still have options there as well that we will be expanding in the new financial year. The St. Philip District Hospital has a ward that still has to be retrofitted, where we can help to bring the relief to the QEH in relation to the persons who they have cognitive accident and emergency. We've been working with them to ensure that we get the persons out of the A&E department so that there's the room that is required. So in the new financial year, we'll also be trying to retrofit a ward at the St. Philip District Hospital, which should hold at least 20 people. And as Minister said earlier, the St. Lucie District Hospital has been renovated and is a beautiful facility. When COVID is no longer, there will also be the capacity there as well, so that's another option. Just wanted to mention that. Thank
you.
Madam Chair, my other comment is, and the question will come, Barbados had been a society where thousands of our citizens left and went abroad, not only to do teaching and policing, but indeed nursing. And I believe that there is still a role that we can play in the expansion of our numbers, but it has to start from within our schools, particularly our primary and secondary schools, where I believe that for career choices, our children can learn in early what roles they can play in helping to serve the society. And I pray that the mentorship will not only be reliant on the Ministry of Health doing it, but the mentorship will be for those thousands of Barbadians who have returned, the returning nationals. Most of them would have been nurses or health practitioners where they were living, whether it be in England or the United States or wherever. And I am just looking at it again in a more community-oriented approach, because I'm glad that the Honorable Minister and his Permanent Secretary spoke to the community care. I did not want to be the one to speak to it because we have already started the process in conjunction with other institutions, particularly Ministry of Health. But I want to know, what plans does the Ministry of Health have in helping with the exciting and whetting of the appetites of young people, that they can want to be able to come into the whole training process to become nurses. Some people say from up front, little children say, I want to be a teacher, and they work towards it. There are few children who are talking about wanting to be a nurse or some person working in a field of medicine. And I therefore want to find out what plans there are in the educational aspect of what the Ministry is doing to engage young children for career choices. And an extension to that, finally, I want to find out, we have the Polytechnic, the Samuel Jackman Institute, and we also have the community college, and there's been some expansion there recently, I understand, because of private entities that are coming in to use Barbados as a location for care of the elderly and so on. So they've got this training program at community college. We've got thousands of Barbadians who have done the care of the elderly program. And I'm trying to find out how they too can be incorporated into it. Many of them have got certificates to show that they've been successful at the levels, but is the ministry planning to involve those persons as part of the nurses and the tranche that is going forward to be able to help us to build up the team of professionals that can continue to serve Barbados at this critical moment when we need them now, perhaps even more than ever. And I will just close on that one, ma'am. Thank you.
Thank you.
Thank you, Honorable Member. I will invite the Permanent Secretary to be able to respond to you, because the Permanent Secretary has been heading up some of the very initiatives that you are speaking about.
Thank you, Minister. Honorable Minister Ford, I first want to remind you of what Minister Bassett would have spoken about earlier, the intention of the Ministry of Health and Wellness to reintroduce the payment of stipend to nurses who will be pursuing studies at the Barbados Community College. I know when I was growing up for sure that the nurses would get the stipend, and it helped them in a lot of ways because a lot of them found that going into the nursing service was a way for them to pull themselves up by the bootstraps. My sister certainly benefited from that when she was a student of the Tertiary School of Nursing, where she got the stipend, and it was really helpful for her to be able to use that to get around, to pay her bus fare and stuff like that. So that will be reintroduced shortly, so that those who go to community college and cannot work because they're there full-time will be able to get some assistance with bus fare, lunch money, if it's the books that they need to buy, that avenue will be there for them. I just also want to indicate that persons who attend the BCC or SJPI and they study for the nursing auxiliary, they can use it as a stepping stone to get into the nursing care system, because those persons can be recruited as trainee nursing assistants in the geriatric system. That's where we find most of them, and they are encouraged after that to pursue the further studies at BCC, and we make allowances for that. Only this year, when we were speaking to the principal nursing officers in respect of providing relevant training for nurses, the area of gerontology was flagged up as one of the areas where the training is not being provided to the extent that is required. And so we'll be working with the BCC to ensure that we have a cadre of nurses who can be trained in gerontology. I have indicated to all of my heads of sections, especially ones who deal with nursing facilities, that this will be a priority for the ministry, because I do agree with you that the ones who help to build the society, now that they're in their elder ages, should be able to get the level of care that is required. So there are plans in train, Madam Minister, to ensure that these persons who want to come into the system will be able to come in, because the incentive will be the stipend. 2, persons who already have qualifications in nursing auxiliary, we have been currently recruiting them in the geriatric system to provide the level of care that's required. And 3, emphasis will be placed on granting training leave for those who want to pursue studies in gerontology. Thank you.
Thank you. Honorable Leader of the Opposition.
Thank you, ma'am. Just a couple of questions that relate to the specific numbers that I have in the document that I received at the hands of the clerk. I wonder if we could be advised as to what is costing the Ministry of Health to outsource some of the medical services which it now has to, or has been having to, whether it's dialysis or other services. What is the cost to the public service when we have to outsource these services? What is driving the need to outsource these services? And do we have options when we outsource as to who the suppliers of these services are? The second question has to do with the medical aid scheme, figure for which as provided is the same figure from 2019 right through to 2024 in the document that I have. What would be the average annual demand upon the medical aid scheme in terms of patient numbers? And how is the scheme accessed by persons? Sometimes people are told various things when they try to do that. How do you access the medical aid? What is the average number of persons, the average demand in terms of patient numbers on the scheme? And then the third question, ma'am, relates to care of the disabled. According to the document I have, that number is being reduced by $500,000 as it relates to the Albert Graham Center. I don't know if this is reflective of the declining scope of the problem among disabled children. What does the reduction suggest to us of $500,000? And then there is also a reduction by $400,000 in terms of the grant to be provided for institutions such as the Red Cross, the Cancer Society, etc. So I would like to know, in brief, what do these reductions in terms of the provision for the Albert Graham Center and for institutions such as the Cancer and Red Cross Society, etc., what do those reductions imply or indicate? What is it costing the government to provide or to outsource medical services? And what is driving the need to outsource that? And how do we choose suppliers? And how do we access the medical aid scheme? And what is the average demand in terms of patient number upon the medical aid scheme?
Thank you, Honorable Member. I will invite the Executive Chair or any of her persons here present to respond to the majority of your questions because they're actually centered around the QEH, but we will provide any other responses as necessary.
Thank you very much, and thank you for your interest in this area. The Barbados healthcare system makes a commitment to all Barbadians to provide services where needed, not just in the public sector, but in the private sector. And where the capacity of the Queen Elizabeth Hospital is outstripped, we then we then provide services through outsource private sector entities to be able to provide those services. I'm going to let Dr. Shani Williams speak to you about the nature of the dialysis service and the demand there for services, and hence why we would have had to acquire services within the private sector. Or I'll speak briefly to the medical aid scheme. The medical aid scheme number has remained fairly static, particularly over the last financial year, because with the onset of the COVID pandemic, we have not had patients traveling. This is a very, very important part of the service offerings of the Queen Elizabeth Hospital and the health system more generally. Were there any services that are not available, or expertise that is not available in Barbados, persons can access overseas treatment and care through referrals from the Queen Elizabeth Hospital. How do you access this service? This service is usually accessed in a very deliberative and organized way. There is a committee that looks, a request is usually made by one of our consultants within the hospital system. He will have to give the justification, the prognosis for the patient, and then a committee that doesn't include administrators, that is purely clinical, will look and make an assessment as to whether or not the case can benefit from overseas treatment. And once that decision is taken, our social work department then goes through a very systematic assessment of the person's ability in terms of whether they have some insurance cover or not, and ultimately comes up with a formula for that person to be able to access care overseas, and then our social work departments arranges with our clinicians to have those persons travel overseas. As a result of the COVID pandemic, we have not had significant overseas travel. In fact, I think we had a few patients overseas that we were able to get back in. But we recognize that although we did not have a significant call on the medical aid scheme budget in the last financial year, we have maintained it at the existing level so that we can ensure that those resources are available should people need to access care not available at the Queen Elizabeth Hospital. In terms of outsourcing, you're aware that the government would have passed the Public Finance Management Act 2019, and I believe steps are underway to introduce further legislation in the area of procurement. The approach that we take to outsourcing is to tender, or where they're sole source providers, because in many instances, the providers of some of these services are limited. There's one or two persons, so we negotiate service level agreements or contracts and seek to get the best price, particularly where those services are singular or specialized. So there's a requirement by statute where the demand is over a certain figure for tendering, but in many instances we have very, very limited providers, so we negotiate. Your interest in dialysis is particularly noted, so I will let Dr. Williams speak more in detail about what is happening in that program area.
Good morning. Shani Williams from the Office of the DMS at the Queen Elizabeth Hospital. So we are spent, as you would understand, the dialysis program is one of the measures that we will treat persons with chronic kidney disease, where we have persons with end-stage renal disease who will benefit from the artificial kidney machine, which will help assist with the prolongation of life. So once the diagnosis is made and they're referred to the nephrologist, we have 2 nephrologists at the Queen Elizabeth Hospital, a decision is made about their additional care and treatment for the end-stage renal disease condition. We have about 300 patients that benefit from dialysis, and we do have to outsource to private providers. There are private providers, one main private provider who has chairs in the Belleville facility, in the Warrens facility. We have chairs at the David Thompson Healthcare Complex, and then our main artificial kidney unit. And of the 300 patients, we have 2/3 of them are done at the Queen Elizabeth Hospital, with the remaining 1/3 split on those 3 campuses that I previously mentioned, the majority being done at the Belleville facility. As you could appreciate also, the dialysis is a 4-hour long procedure. So if you have 25 chairs, each patient is on for 4 hours. And so we don't have the capacity on site to manage all 300 patients at this time. Also, the nephrologist will determine who will benefit from transplant, and we do have a transplant program, but due to the pandemic, we weren't able to offer as much of that service in the last 12 months, as we have a transplant surgeon who will coordinate with an external transplant team so that we can help to remove some patients who qualify off of the dialysis program. It is an expensive venture, and my understanding is that we would have spent about $3.6 million in the last financial year undergoing this dialysis program.
Thank you.
Ma'am, I'm happy for the information. When I made reference to dialysis, I was simply being illustrative. Given an example, I was concerned with the cost for outsourced services generally, dialysis and other services. I don't know the extent to which services are outsourced and the areas of service which need to be supplied by external entities. So I was looking for an idea of the overall costs. I heard last year 3.6 million with respect to dialysis, but what about other outsourced services? I'm glad to hear that the tendering process is being used. I understand in some cases the expertise may not be available other than in one entity, and therefore you have no option. With respect to the medical aid issue, I really was looking for a bit more information as to how the patient actually interacts with the system. I think I got more of what the system, how the system behaves internally, the bureaucratic processes. But more so, I would have wanted to hear how the patient interacts with that process, because that is where we meet the problem, Madam Chair, as you would know. And I still would like to hear why we have $500,000 reduction in the provision for the Albert Graham Center and a $400,000 reduction in the grants to institutions like Red Cross and Cancer Society, etc.
Thank you, Honorable Member. I will invite the Permanent Secretary to respond.
Thank you, Minister. In relation to the reduction in the estimates allocated to the AC Graham Center, when we reviewed the personnelments for the current financial year, we found that there were a lot of positions that were being provided for that were not filled, and so therefore, in order for us to be as prudent as we could be, those were taken out, which will result in some reductions in that area. In relation to the subventions that we would normally provide to NGOs and civil society organizations, it was a matter of competing wants, and last year we were advised that we had to trim our budget, and therefore that would have carried over into the new financial year. So the costs associated with different NGOs and CSOs are much less than previously, because it is trying to balance the budget and see what can be left out or what has to be trimmed, and the trimming was not only done in those areas but in other areas as well, sir.
Honorable Member for St. John.
Thank you, Madam Chair. Let me join the chorus of my colleagues who are bigging up the Minister for his outstanding work as it relates to the COVID pandemic on the island. I also want to take this opportunity to salute the Executive Chair of the QEH for her work in relation to what she's doing on the landscape. But my questions are about the polyclinic at St. John, and I want to thank the Minister and this government for moving to a 24-hour service in the constituency of St. John. My questions, Minister, relates to some concerns that I've been getting from constituents in relation to some of the operations at the polyclinic. For example, there are 2 spaces allocated for the dental department at the polyclinic, but at this point, none are actually working. So if you can provide some information in relation to how soon we can have that service again at the polyclinic, I would like to hear from you. Should I ask all the questions now, Chair? Fine. Thank you. In relation to the gym, last year, I believe around the same time, I would have asked about when we can have that gym up and running. If you can shed some light on that, I too would be grateful. The Executive Chair would have mentioned just now something about social workers, and I'm wondering as well if it is possible. From my knowledge, I do not remember there being a social worker at the particular location, but I am concerned about mental health. If not a social worker, someone with similar qualifications to deal with all the issues that are now revolving around this pandemic, because it is causing some serious concerns for families. So if you can answer those questions, Minister, I would be grateful. The last one, I toured the polyclinic some time ago, and I know that there were 2 members of staff that were concerned about a server that was in the room that they were working in. The concern was, I believe, the level of radiation that would be generated from that particular piece of equipment. And they were requesting at the time that it be relocated to another area within the complex. I will stop here at this time for your response.
Thank you, honorable member. I will speak to, provide a response for one of your questions, that is dealing with the gym. The gym at the polyclinic at the David Thompson Social Services Complex, Health and Social Services Complex. In the initial stages, the gym was actually reserved for, I believe it was the Heart and Stroke Foundation in a partnership which would have allowed them to be able to have access to the gym. But this really has not happened in the way that it was envisaged, and the ministry took a decision that the gym should be provided for services within St. John, and that some partnership should be entered into with an entity from the area, somebody from the area who would be able to manage that. And I'm sure that in the next financial year that we would be able to conclude those arrangements, so that you'll be a very happy member of Parliament in that regard. I will ask the Chief Medical Officer if he can speak to the issue with the 2 dental spaces, and I'm giving that to him because he's been part of a team dealing with the issue of our dental program, which we have been struggling with, to be honest with you, and I will ask him now to speak to that, and that will be followed by the director of the psychiatric hospital who manages the mental health program to see if he can respond to you in relation to St. John Polyclinic.
Thank you. The issues of providing comprehensive dental services for all Barbadians remains difficult for the Ministry of Health. What we have tried to do is to maintain a national service. We have consolidated our dental teams and our dental programs to specific polyclinics based on a reflection that our human resources is not optimal at this time. We will endeavor to review our systems. We are aware that there's hardware there at the David Thompson Health and Social Services Complex with respect to dental services and the equipment that is there. And what we will do, we will undertake again to review and see how we can provide a service. I won't be able to guarantee a daily service, but certainly a service that will be helpful to the people of St. John.
Dr. George, is there room for pro bono from the private dentists? I remember hearing a few of them mentioning this.
So these matters are being explored. There are a few dentists that have indicated their willingness to work in the government sector. Please note that dentistry in Barbados is very private sector driven. We only have about 3 to 4% of dentists within the entire Barbados service in the public sector. They seem to be drawn to the private sector. However, there have been a few that have indicated their willingness to work with us, and I'm sure that we can have a service in short order for the people of St. John.
Good afternoon. David Leacock, Director, Psychiatric Hospital. With respect to your question, Minister, concerning the mental health status or the need for social workers within the St. John Polyclinic or the St. John area, we currently already have a dedicated community mental health team. This includes a psychiatrist and a community mental health nurse that are stationed at the David Thompson Center. The psychiatrist, Dr. Sue, sits on the Health EOC, and she's responsible for the entire St. John catchment. The nurse is based there full-time, and the doctor visits as needs be. At present, they're there every Wednesday, but the nurse is there most days to start his daily activities. As it relates to the concerns or the issues that are arising, based on the fact that we do have COVID going on, we have seen an increase in the need for mental health services in some of our polyclinics, and St. John is no different. What I can say is that we've been able to meet most of the needs of our persons in the community, and we continue to expand our services. During 2019-2020, we also added a social worker and a psychologist to some of our polyclinics, and for the St. John area, the social worker is there based on the need. If there's a requirement, the community health nurse or doctor contacts the social worker to assist as far as those persons are concerned. So at this stage, it is not across the island as we speak, but for certain polyclinics for sure, we do have support beyond just the community health nurse and doctors. We actually have psychologists and some social workers at those polyclinics as well.
Mr. Leacock, how well is your outpatient nursing serviced? I have had some instances where, well, obviously manpower problems where patients weren't able to get repeats of their medication because I believe some nurses would dispense medication on the outside. How are we with that?
But once we had the onset of COVID, we did adjust some of our protocols to ensure the safety of our clients and our staff. But for the most part, we were in some cases given advanced issues of medications, thanks to drug service, provide us with additional medications during that period. So we try to make sure that if some persons, for example, could adequately manage, we would give them an increased supply. If they were accustomed getting 2 weeks supply, we'd give them a full month supply, and in some cases up to 6 weeks supply. So this was based on what the supplies of medications were. The In most cases, I said we didn't have any complaints. We gave persons contact numbers so they could either call the pharmacy directly or could call the community health nurse or doctors so they had to, if they need to get the medications replenished. As far as those who required long-acting injectables, they were also being administered as need be. We had one or two hiccups when it came to some staff who might have been exposed to COVID, but we did in turn then send internal staff out to augment the community services. So we, for the most part, through 2020, were able to meet all the demands from a community-based standpoint.
Thank you.
Thank you, Director Leacock. Just a follow-up question for the Minister and a comment to yourself. Minister, based on the location of the St. John Polyclinic, can you indicate if this will be a home base for any ambulance service? And to Director Leacock, I would have made my tour of the polyclinic on a Monday, so maybe I miss your personnel. But I think that you need to do some PR work to let it be known that this service is available at the St. John Polyclinic, because I was not told about it, and I'm sure that a lot of the constituents in St. John and the surrounding areas are not aware. So maybe you need to push some PSAs to let the public know that these services are also available at the St. John Polyclinic. Thank you.
Thank you, Honorable Member. The idea of having an ambulance station at the St. John Polyclinic is part and parcel of the 24-hour service. We've been looking at that, definitely based on what we see happening at that polyclinic in the not too distant future. And I believe, and I will ask Mr. Tony Harris if he wants to comment on this, but I believe that that is also a part of the plan in relation to the cardiac project. No?
Good morning. Anthony Harris. Yes, the whole upgrade of the ambulance service is planned with the cardiac project. As you would appreciate, a well-functioning ambulance service is going to be essential if we are going to be able to get to patients and get them to the hospital or any center, any urgent care center. I have had the pleasure of touring the St. John Polyclinic with a view to assessing its ability to function as an urgent care center to assist with the whole network of facilities that can improve cardiac care for patients of Barbados. I have been pleasantly surprised that the St. John Polyclinic seems well equipped and well positioned to provide this service. But of course, we would have to have the structure of the supporting services of a good ambulance network to help us with that. So that is also a plan. I know that there is a contention that should it be there, should it be at the St. Philip Polyclinic, where are we going to have the station? But obviously some nearby ambulance service has to be provided if we are going to maximize the effect of the St. John Polyclinic in this entire network. Thanks.
Thank you. Honorable Member for St. Philip West.
Thank you very much, Madam Chair. Minister, I know some time ago that the Ministry of Health was responsible for taking care of delinquent lots across the island. This is something that we have a problem with, where lots of people own properties and refuse to clean them, especially in residential areas. And there was a program where the Ministry of Health would actually clean the lots and actually charge people. I'm wondering if that is still available, and if so, what is it doing? That's my first question. And then my second question would be, I've been told that the CMO has certain powers conferred upon him, especially if you're talking about public health crisis. And yesterday, I heard the Honorable Minister responsible for beautification in the environment speak about the inability of his officers sometimes to go onto properties where there were littering and where there was things like that going on, and they were having difficulties. And I'm wondering if the CMO, as this too can be seen as a public health problem, has any powers in helping to resolve some of those matters. Thank you.
Thank you, Honorable Member. I would invite the Chief Environmental Health Officer to respond to your first question in relation to delinquent lots, and then I'm sure that the CMO can speak for himself.
Good morning, Good afternoon, Francina Bascom, Chief Environmental Health Officer. The Environmental Health Department under the Ministry of Health, we operate under the Health Services Act, so we would serve notices to delinquent landowners, but we have no facility under Environmental Health, Ministry of Health to clean vacant lots. We had that about 3 years ago, but that program is no longer on the Ministry of Health. I believe it is under now Ministry of Environment and not Health. So we don't have that facility to clean vacant lots in Ministry of Health.
So could I go ahead?
Yeah.
So to follow up from Francina, the Ministry of Health under the current legislation has the powers based on the Chief Medical Officer and direction from the Minister of Health to enter vacant properties, to enter households, and to enter any premises that they feel that there is violations of the Health Services Act. Many of the violations are written in the nuisances part of the Health Services Act, but I will be very surprised if officers are being impeded by their work. And if that is indeed the case, this needs to be brought to the attention of Central Ministry, because it is written in law, and we have had many instances over the last 2 to 3 years where public health officials, and specifically the environmental health officers have entered businesses to carry out their work, and frequently this ends in prosecution. So that if these cases could be brought to the attention, we will certainly make them a priority. Thank you so much.
Honorable Member for St. Michael Southeast.
Thank you, Madam Chair. A pleasant good morning to the member for Cindy City and also to his entire team. Let me join all of my other colleagues in congratulating this particular team, not to single them out as the Honorable Leader of the Opposition indicated, but to simply say that as a Barbadian, I too am extremely proud to be associated with this team. I think, growing up, you've heard a lot about the healthcare professionals and how many of the persons who pass through the system have gone overseas and have represented Barbados in this field. During this pandemic in the last year, we've had the opportunity to have exceptional leadership amongst our healthcare professionals, and I just want to salute all of you and all of the people who work closely with you. I know that it has not been easy. I know that we have not always done everything the best that we could do, but I do know from sitting with many of you that it is clear that you have the best interests of Barbados at heart. And I just want to say that we truly appreciate all of the efforts that you have made, to get things right, and even where they've gone wrong, to make them right and to make things better for all Barbadians. During this period of the last few months, I think that we have to reflect on where we are in healthcare. I do feel that there have been a lot of positives that have come out of this period, and in particular, I think we've all recognized that we've probably accomplished a lot more in 1 year than perhaps we've done in a number of the decades that preceded us. And I say that simply because we've now seen Barbadians move towards embracing what we would refer to as telehealth. A number of the doctors have actually started to embark on that journey. I'm not so sure how much the hospital has embraced it at this point in time, but I do feel that where there may have been reluctance before to embrace that type of virtual healthcare system, that this period has actually taught us that we need to move more towards the various technological mediums in order to be able to speak to our patients, and certainly have patients be able to speak to their doctors to avoid waiting times, and certainly times particularly at the hospitals and the clinics. We've also seen that the consumers are willing to engage in that type of medium. And we've also seen the hospital respond during the pandemic by being able to implement things like the Seek and Save surveys, having persons go into the field to talk to people to gather information. Again, things that may not have been as well known before or even done with the type of vigor that we saw over the last couple of months. My question simply is that with all that we have done and all that we've implemented in such a short space of time, it obviously says to us as a people that we can do more, and we don't have to wait on a pandemic in order to make a number of these very systematic changes within the healthcare system. I'm therefore curious from these estimates, what is the way forward for healthcare? What are the plans to use these mediums that we've used in the last month to improve and to enhance the delivery of service to the wider population of Barbados?
Thank you, Honourable Member. I will invite the Executive Chair of QEH to respond to you.
Thank you.
Thank you, Minister Bradshaw. You're extremely correct that the onset of the COVID pandemic has caused certainly the hospital and other areas of the health system to have to respond in unprecedented ways, including increased use of technology. What we began to recognize is that the government's broader vision that called for the establishment of the Ministry of Innovation, Science and Technology, the government's broader vision of investing in digital transformation has become critical for the future of healthcare going forward. It is a vision of the Minister Board of the hospital, or long-term vision, is to really transform Queen Elizabeth Hospital into the next generation smart hospital. In order to do this, we need to build some critical infrastructure, and what we've put into our estimates is the result of having spent time and develop a 5-year strategy for technology. What it says, and we recognize it as we started to build out and try to utilize technology more, we recognize that we were having some critical gaps, some inability to respond as we would have liked because we didn't have the underlying technology infrastructure. So this experience of COVID has really catapulted us, along with very strong leadership from the Ministry of Information, Science and Technology and the Ministry of Health, Mr. Burgess and Mr. Connolly at the hospital, to really look at how we can optimize the existing systems that we have. And we've put into our estimates this year to really start that journey towards building out our 3 to 5 year vision. It will involve first strengthening our Wi-Fi and broadband infrastructure at the institution. It will then next focus on the area of building out our server infrastructure, dealing with data virtualization and other efforts to have a much more efficient data and information system. It will deal with strengthening of cybersecurity and governance and other policies required to make sure that patient information is kept safe and secure. And all of these really are driven and underpinned by what is happening in the broader government to create an information superhighway that we can move seamlessly between the hospital and other areas of the health system. So you're correct that technology is really the future direction within which we are going to be carrying health services, and COVID has certainly shown us that we can start and go in those directions. Our pharmacy service is technology, medication delivery service. We always credit Minister Cattle for pushing us in that direction. And other recommendations that have come from across the spectrum to build out our IT infrastructure. The second, and I'll say quickly because I recognize time is upon us, two important areas in terms of technology in the future. We have to do a much better job, and COVID has taught us that alongside the health epidemic, I've also said we've had an infodemic, an information pandemic, and what is required is a much stronger engagement with the public, with patients, and with staff in how we respond in real time and provide information and access to accurate and correct information. Technology is going to play an important role in how we do that as an institution, and also how we expand delivery of services as an institution. We're finding increasingly that the investments that the government have made, particularly in equipment, which has been unprecedented, as you're aware, Minister. We've invested $15 million since we've come to office as an administration in equipment for the Queen Elizabeth Hospital. And many of those pieces of equipment are the latest in the current technology in their infrastructure. So it behooves us to strengthen that underlying infrastructure that we can optimize what is happening now and into the future.
Thank you, Executive Chair. Minister, we just invite our Information Technology Manager at the Ministry, Mr. Burgess, who would like to make a comment.
Good morning, Junior Burgess, Acting Director of Information Systems. I think I'll continue from where Executive Chair ended off and speak of information systems and information being shared across the health service. And I think that is one of the critical factors that we need to address. During this pandemic, the need to work with so many different entities has caused us to develop a system now where we can pull information from immigration, or pull information from Electoral and Boundaries Commission to help us respond to all the needs that have arisen. One of the things that we're looking to do in the next financial year is to evaluate our health information system. We have a system that we utilize that it works and serves the polyclinics well, but that link with QEH, to my mind, is missing. So we need to find a system to make sure that the entities can easily pass information. A patient may go to QEH first and access services there, and then continue continue on in the polyclinics. So we need to have a system that allows us to move from one area, one institution, to the next. And all of the information surrounding that patient that is critical for the second entity, they'll have access to it. So one of the things that we're going to do for sure is to evaluate our current system with a view of improving that system to make it better for the clients. That is one. Then one of the things for me, and I've said that to the Permanent Secretary and the Minister, one of the areas for me which has to be a huge focus has to be environmental health. When I look at environmental health, when I first came, I joined the ministry only in July 2020. I recognize that they're still using books to get information. So if a person registers in Oystains for a business and wants to have that business in St. Peter, they must go to St. Peter and start the process all over again. There's no transfer of information. So these are the sort of systems that we need to implement within healthcare to make sure that our clients are not burdened with producing the same information 3 and 4 and 5 times. So technology definitely is critical in ensuring that we create a health system that is responsive, a health system that allows the users to easily get information and to easily do business. And I'm well aware that is part of the government's vision in the digitizing the whole of government. One of the final things I'd like to highlight is the registration unit in the ministry, where doctors are coming for registration and nurses and the paramedical entities. We started the process already. Thankfully, by the blessings of the government, we bolstered the human resources within our ministry, and we started developing a system for firstly registering doctors so that the entire process can be done from their home. We tried it this year. We didn't get as far as we wanted to get, but I know that we've had meetings last week, and that is a critical focus for us, and it's one of the first things we're committing to do, to make sure that system is fully built out and make life easier for, again, our clients. So IT will play a huge part in the next financial year of streamlining services offered by the Ministry of Health and Wellness.
Thank you.
Thank you both for that elaboration of what the plans are for the ministry. Let me just add to that I do feel very strongly that that is the way forward in terms of how we manage our health systems, and making sure that the public is fully aware that they're on board moving forward as well. One of the things, however, though, that also concerns me is the issue of patient care and how we treat to our patients, how we treat to persons using the hospital. And this is not to say that we have healthcare professionals who do not care, but it is to say that there are a set of persons who have interfaced with the Queen Elizabeth Hospital and other healthcare providers, and have expressed concern about the way in which the interaction with them takes place. And that could be from the reception, that could be from the nurses, it could be from the doctors. As you could appreciate, if you are terminally ill, if you are there with a soft tissue injury for care, people obviously are at their most vulnerable, and I believe that we have to have some level of training or ongoing training to constantly remind the persons who are providing the service to the public that really the consumer is perhaps the most important person in the whole equation. I know they're difficult persons from time to time, but I do feel that this is an area that we have often fallen down in. And I'm just curious as to what is being done by the hospital to ensure that the experience of the patient who is going through, a number of things when they come to the hospital. It could be grief, it could be terminal illness, it could just be, basic sickness. What is being done to make sure that the staff appreciate and understand the priority to the patient and to patient delivery of care?
If I may add to that, Honorable Member, I'm also concerned, you speak about the patient, but I'm also concerned with respect to family members, especially now in the COVID environment, where family members aren't allowed to really visit patients. There is a need for better communication. Normally, I'm a strong advocate for doctors and nurses, but there's a strong need for better communication between the doctor or the medical team and the families of the patients. I have had cases where feeding the patient was a problem because the family could not be allowed to go in. Then you can't reach the doctor by telephone, which is the only resource that the families have. And I am very deeply concerned about the non-communication between families and the medical team.
Thank you, QEH.
Thank you very much. This is actually one of the most difficult questions, Minister, that we've had to, or we have to answer this morning, because it is a significant Achilles heel, I would say, of the Queen Elizabeth Hospital, that despite the positive outcomes that we come, despite providing exceptional care, people come into our accident and emergency room in accidents, broken up, and within months to weeks walk out of the hospital. Despite all that we do as an institution, we continue to receive significant complaints, particularly around the area of communication with patients and communications with family. So, honorable members of Parliament and ministers, to flag this as a significant issue, I think is accurate, and this is something. What we're trying to do is, one, improve an area of clinical work called disclosure training, which is where we train our doctors and nurses how to communicate more effectively in providing information, sometimes bad information or information that will not be received as well because it is necessarily a poor prognosis. So we're improving our disclosure training. Secondly, we're trying to do more in terms of the in-house training of of all of our service providers, particularly our nurses and our doctors, around the area of how to communicate with families. We have introduced a system of patient rounding by a group, a multidisciplinary group across the hospital that takes place on a weekly basis. And what we're able to do is pick up patients who feel that they're getting insufficient information from their physician, and patients who need to get in touch with their family. And we were believing that we have to expand that service. COVID has restricted entry of families to the hospital, and we believe that this is an area that has suffered as a result the ability to engage more frequently with families that we used to do during visiting and other times. So we are looking at improving policies in this regard, and very practically improving the level of training. And as I would have mentioned a moment ago, in terms of technology, what we're looking to do is introduce technology that allows us to hear in real time from patients and from their families about what is happening, so we can intervene. Very often, we find ourselves very much on the reactive end of things, and we think that is an inadequate position. So we take the critique as an institution. We recognize that we do have some strengths, but this is an area that we certainly have to do better in.
Mm-hmm. Thank you, ma'am. I just want to reiterate again that, you know, I'm a firm believer I would not be here if I did not have good patient care. And therefore, I am going to always be a strong advocate that the way we treat the people in their deepest, darkest hour has a very significant psychological impact on them and their own recovery. And so I will always encourage the Ministry of Health and Wellness and the team at QEH to pay particular attention to this particular area, because it really makes the difference between a positive outlook and recovery and one where people feel as though they are pretty much doomed, you know, to die or to continue to be ailing. That therefore brings me to my final question, which relates to cancer care. I heard, I think, the member for St. Michael South Central raised the issue of this earlier in relation to the context of the future policy. And I know you've spoken, Minister, in relation to the National Cancer Plan. I was happy when it came to cabinet. I'm happy now to hear that we're a little bit closer in this financial year to being able to roll that out and start to implement it. I want to just make the point that, yes, we have to focus on preventative measures. We have to make sure that we have the necessary equipment that is available. But public education is going to be critical as well to allow persons to appreciate that early detection is key. And we have to find ways, whether through individuals who people will listen to, or basically using persons who've been through the process of cancer care and certainly treatment, to be able to get the message across to the wider population as to the importance of early detection. I am a strong supporter of genetic testing. It was one of the things that I went through early on. I'm also a believer that we need to accelerate the process of having the PET scan equipment, which also provides for that early detection, but also helps us to identify whether the cancer has spread to other parts of the body. Because I think people need to be able to plan their lives and to know basically, you know, how much time do they have left on Earth. I would wish to just hear a little bit more about those plans. What type of support are we providing, even in the interim, as we start to roll out the plan? Because over the course of certainly my treatment, I heard from many people who spoke about the fact that, again, they did not have full information while they were going through treatment. You know, if they were at stage 4, they felt like pretty much they were being left to die. I think all of these things, and I think the director spoke to it just now in terms of, you know, upgrading the way in which we interact with patients. But I think specific to persons who are going through something as traumatic as cancer and they have a terminal illness, I do feel that more particular attention needs to be played in that area, but also in the area of prevention. And I'd want to hear more in terms of how close are we to genetic testing in Barbados? How close are we also to acquiring or working with the joint partnerships in relation to PET scans, which in particular, the latter is obviously a very complicated process. So is there hope on the horizon quite soon for those persons who may not be able to travel to the United States or to any of the other islands to be able to access it? How soon are we going to be in a position to have access to those two things?
Thank you, Honorable Member. The genetic testing we would have spoken to earlier, that is part and parcel of the new direction that the Best Dos Santos Public Health Laboratory will be going into, in partnership and in collaboration with some of our technical people in the diaspora who have offered their services. Dr. Beckles would have spoken to that. So that is definitely on the horizon. And I will invite the QEH, since we are dealing with treatment in relation to cancer, to respond to the other part of the question.
Thank you. I'm just going to speak briefly and then perhaps involve my colleague, Dr. Shani Williams, as well. Cancer treatment is an area that has benefited from investment by the Lionel Clara Foundation. I would say, Minister, I think you're correct that the approach to cancer treatment needs to be re-engineered or revitalized in Barbados. And it is something that we're looking at the hospital, and we've taken some steps, as you said, with the investment of equipment. But correctly so, Minister, improving cancer treatment is more than investing in equipment and specially authorized drugs. We need to re-look at our entire approach. We are right now focusing on a very strongly biomedical model that is extremely siloed between oncology, hematology, then there's pediatric oncology. We are looking, aware that Dr. Cave, and apologies for his absence as he is unwell, is looking at how we can better reorganize the delivery of cancer services at the hospital so that it is more seamless and that we can benefit from synergies between the various teams at the hospital. We also recognize that receiving a cancer diagnosis in order to have that positive outcome that you're talking about requires supportive care. So in addition to treatment, we have to be able to provide the support and care which goes beyond our biomedical model into the domain of using complementary therapies, into the domain of providing support through counseling and peer-based support and other kinds of initiatives. So we are looking at an institution and as an institution at how we can better reorganize the delivery of care, that it can be very, very people-centered and patient-oriented and respond to the patient's needs in these various dimensions. And currently, as we are organized, we are not doing that, and hence some of the challenges that you have correctly identified. And this is a challenge to us as an institutional team that we readily take, and we're already taking the necessary steps within our estimates to get the kind of investments. But it really is going to take a change of mindset between clinical teams to work more effectively and synergistically, and then involve other practitioners and other kinds of therapy to provide the necessary support that patients with cancer need. Dr. Williams, have I missed anything?
I don't really have much to add to what the executive chair had said, because she is highlighting how we are trying to do a holistic approach to the management of cancer care in Barbados, QEH in particular, by re-engineering the services, as well as I said before, making it holistic using complementary care, support services, and so on. And that strategy, albeit medium to long term in our fiscal planning, we are considering the access to more sensitive pieces of equipment through the medical aid scheme for the individual person as they present to our services for care and treatment. So we do negotiate through a network service provider to access in other jurisdictions the availability to use the linear accelerator or indeed the PET scan to do additional diagnostics and scope of works to streamline the patient's care and treatment. So that is a system that we already have in place that we can do through the medical aid scheme once we have the patient's care and treatment prognosis determined.
Thank you. If I may beg the, sorry, somebody was speaking? If I may beg the indulgence of the member for St. James South, just to add or to query, you spoke about the holistic approach to cancer cure, but I am getting WhatsApps and emails and so on now with respect, and I know the permanent secretary spoke about decreased funding for the NGOs, but there's an entity which you know of, the Cancer Support Services, and I'm hearing that their funding has been halved over the last couple of years. I know they're a state where they open only 3 days a week. They service people that have been discharged from the hospital. They offer oxygen, they rent beds, they offer counseling. And I think this is an area of concern because of the COVID situation. They're no longer able to have, at least for now, fundraising efforts. Normal donors, because of the said COVID, cannot contribute what they normally do. At the same time, we speak about equipment, but what about that support, especially in the COVID situation where they deal with depression of cancer, not being able to see family members and so on. In my opinion, I think something needs to be done with respect to the funding. Honorable Minister or Ms. Sutherland may answer me on that.
Thank you, Madam Chair. I do agree with you, and I can say here that I have had discussions several months ago, I believe, with the President of the Cancer Support Services in this regard. Regrettably, just as dynamic as COVID has been for us, so too has been the provision of healthcare services, and we've been doing a lot of dancing depending on what comes up at a particular point in time. And we try to manage because we know that the country cannot afford to give us everything in terms of finance at this point in time. And we try not to leave any entity behind, so that if there's a dire need, then we later, as the new financial year progresses, between the permanent secretary, who is the accounting officer, and her financial controller, they try to dance, as I would say, and to find funding from some of the programs within the Ministry of Health to be able to facilitate the assistance to these organizations, and I'm sure that that will continue in the next financial year.
Thank you, because I've also benefited from continuing medical education from this same entity, and I would hate to see it to go under. Honorable Member for St. James South.
Thank you very much, Madam Chair. I want to also congratulate the Ministry of Health. I think that during this crisis, you have demonstrated to this country the quality of excellence within your team and your capacity to have responded to a crisis that could very well have swept the entire country under and make us untenable. St. James South, in particular, our seniors are very grateful for the work that you've been doing, and especially in making sure that they get covered with vaccines. The one question that I want to pose is, in St. James Parish, we have close to 23,000 residents, and you're talking about a parish that has people from all walks of life. There is a tendency to feel that people in St. James have the necessary wherewithal to take care of all of their health needs. But what we have experienced within the parish is that we have some older districts where people have retired, their income has been limited for a very long time, and the increases in the cost of living, etc., COVID, the unemployment among their children, etc., has placed tremendous pressure on some of our older citizens who are living sometimes on their own. And a number of them have had to shift from purely going to private doctors and going to pharmacies to buy medication to shift to the more public system in order to be able to get medication, because as those costs escalate, it makes it very difficult for them. And in St. James, we really do not have a polyclinic. The polyclinic in which our residents have to go is to Black Rock. And Black Rock, as you know, would be heavily utilized by the St. Michael populations. So this has become increasingly difficult for them in their straitened circumstances to access care in the way that they need it. Now, I was very, very pleased to hear that you are planning to continue or expand the program where you're going to have persons in the community going out to be able to give care so that we reduce the demand for geriatric hospital residency. What plans do you have for expanding other types of nursing or medical services that would help ease the difficulty of the seniors within the St. James catchment area to receive services rather than having to be caught up in a over-pressured Black Rock Polyclinic trying to get services and to get medication?
Thank you, Honorable Member, for your question and your concerns. Let me say that, well, first of all, St. Michael is where the majority, that's the most, the population lives within the St. Michael area. But there are 3 polyclinics, Edgar Cochrane, Winston Scott, and there's the Brantford Tate Polyclinic that provide for St. Michael to a large extent, and also Eunice Gibson. Now, we know that we don't have a polyclinic in every parish, and I don't think that this is doable anyway. But for the persons of St. James, the polyclinic, whichever polyclinic is assigned, that is the one that they will have to work with. I don't see anything else happening in the near future in that regard. And St. James is not peculiar in this respect because there are other areas that are similarly impacted. I don't think we have a polyclinic, for example, in St. Thomas, and the list can go on. But what it means is that we would have to be able to provide greater service to that catchment area. The services are there to be acquired by persons, and I don't think that there's a difficulty in doing that. But where it comes to elderly persons and elderly care, what I outlined before in collaboration with the Ministry of People Empowerment and Elderly Affairs, that is the direction that we as a government, because it crosses ministries, that is where we're going in terms of community care and providing that level of care that you are asking for. So I hope I've been able to answer you in some way, but that is the reality of the situation. For example, we have one tertiary care institution in Queen Elizabeth Hospital. Is located in one part of the country, but people have to get to QEH from all over the country. So I'm just saying that to demonstrate to you that there's no way that we'll be able to provide for every single parish.
Thank you. Thank you. I just wanted to know what other community services are being planned that will help to ease that situation, because as much as I would love a polyclinic, I know that we can't get one right now. My other comment, Minister, the issue of NCDs is a chronic problem that is really ravishing our populations here in the Caribbean. And it is something I know that we address nationally, but we also address it as a region. And through COSOD, I know that the Ministry of Health has been working with other ministries around the region to look at what we are going to be able to do in terms of managing the incidence of NCDs because of its impact on our economic growth, on the quality of life that people have, and family care, etc. We would have had a joint meeting with COTED and COSOD in which the Ministry of Foreign Affairs and Foreign Trade would have worked with the Ministry of Health to start looking at how we can use trade policy to be able to fight with the NCDs in terms of using trade policy to determine the types of products that should come in and various other strategies that we want to look at. One of the things was the front of package labeling, which was the first part, I believe, of the discussions that you had. And last week, the ministry had discussions with the Barbados Private Sector Association and the BMA because they have some concerns about labeling, the timing, the cost, the issue of previous contracts. How are they going to make the transition to the front of package labeling? My question is, besides the front of package labeling, what are some of the other elements of the strategy on NCDs, and if there are things that at a regional level we could assist in protecting the health of our nation through that joint effort?
Thank you very much, Honourable Member. I would like to invite Dr. Arthur Phillips, who is the Senior Medical Officer of Health with responsibility for NCDs, to respond.
Thank you and good afternoon, honourable members. The issue of front of package labeling and the interaction between trade and NCDs is something that we believe is very important. We do hear, and I believe I'm hearing it again, the concern expressed by industry about the potential perceived negative impacts of some of the measures that have been shown to be effective on their businesses. We believe, and we've actually taken steps to ensure that we are well advised, that the front of package labeling as proposed by Ministry of Health, by CARPHA, by regional academics, and by extension by CrossQ, can be implemented in a way that will be beneficial to the publics across the region without having significant negative impacts on our local or regional businesses. We believe that it should be done in a phased manner, and that it needs to be guided by the evidence of what is effective, what actually informs the consumer and helps them to make good decisions, useful decisions for them in terms of their health. So we continue to engage in the process through BNSI with the National Mirror Committee and CrossQ to give our input and to work with our industry partners in discussing front of package labeling. But we have a firm position that front of package labeling as currently proposed by Ministry of Health is guided by the evidence, and we would wish that our industry colleagues would partner with us and would work to advance this. In terms of the other things that are occurring, I just also want to mention, in terms of the issue of trade, it was one of the issues that the industry did raise. They expressed concerns about negative trade impacts as well as...
Sorry, Dr. Phillips, if you don't mind, could you pull your microphone a little closer?
Sure.
We're straining to hear you.
My apologies. Yes. So one of the issues that the industry did raise was that they felt that there may be negative trade impacts of implementing the front of package labeling system as we were proposing it, including the potential for negative implications in terms of our WTO obligations. We sought neutral trade policy opinions to ensure that we were well advised, and we are comfortable that it can be done without offending WTO or other trade commitments. On the issue of considering the restriction of items based on them not being healthy or them being unhealthy, that's a conversation we're certainly willing to continue to have with our partners in foreign trade. But our emphasis at this time through the front of package labeling, as well as in terms of the regional discussion about the nutritional labeling more generally, is really to ensure that consumers have systems that allow them to make informed choices about what is available to them so that they can enjoy good health, particularly around the issue of NCDs, because diet is an extremely important contributor to the burden of NCDs, which in Barbados is our leading cause of illness and death. So yes, we're willing to continue to engage and to discuss on the trade interactions with health. We think we have made good efforts in doing this, and we will continue to advance. We are concerned about the apparent lack of support for front of package labeling that we're seeing from industry. Thank you.
Just to rest assured that we were able to reassure the private sector that from the perspective of foreign trade, we will be examining the very best way to make the transition so as to minimize the impact on business, so as to ensure we are WTO compliant, but most assuredly that we will be moving forward without any unnecessary delay to take the necessary steps in order to protect our population from the impact of sugar and salt and fats in their diets, and to ensure that we are able to provide a very healthy diet for the people of Barbados and for the people of the region. And we're looking forward to meeting again with you as soon as you all can arrange it, that we can press forward on this important matter of fighting against the NCDs.
Honourable Minister, before the topic gets called, I'm looking back on my notes, and the member for St. Michael South East had asked a question about the PET scan and possible availability on the island. There are many patients that have a serious fear either of travel to get treatment in a strange place, in a strange hospital, with strange doctors. Some are unable to travel for health reasons. Where are we with respect to obtaining a PET scan?
Thank you, Madam Chair. I cannot answer your question directly at this time, but what I want to say is that we have recognized in a serious way that the purchasing of services for us is perhaps one of the avenues of approach that we should pursue in this matter in relation to cancer and other things, some of these programs that I spoke to you about, cardiac care, etc. And that's why I emphasize in the beginning the need that our strategy is to have an integrated service, including collaborations with private sector entities. And I say that because we were considering at one stage in the Ministry of Health and Wellness through QEH that we could look at purchasing a linear accelerator. But when the research was done by the Queen Elizabeth Hospital and recognizing that there were at least 2 private entities on island that were seeking to do the same thing, it became apparent to us that it was better for us to be able to purchase those services rather than try to acquire the linear accelerator. And similarly, this is going to occur in relation to other aspects, maybe including the same PET scan that you are speaking about.
Okay, Honourable Leader of the Opposition.
Thank you, Madam Chair. Just a couple of quick questions, perhaps. You're moving to a level, if these estimates are approved, of a transfer of $120 million, I think, to the QEH. And I just wanted to query from a Ministry of Health perspective, from the QEH perspective, just want to query on the performance of the health contribution. I noticed next year we're projecting 177 million. Just wanted to query there for the performance of the health contribution that was imposed by the government from a QEH perspective. The other thing is the literature suggests that between 20 to 40% of resources are lost through wastage and matters of bad procurement practices. I think I raised this last year. I want to raise it again because I'm interested in finding out what the Ministry of Health, particularly so the QEH, is doing about creating efficiencies through reduction of wastage and dealing with matters of procurement policy. And I don't want to be told that there are new financial rules and all of this. I want to know what practically is being done to deal with the matter of procurement and the reduction of massive wastage, and also what is the performance of the health contribution in light of the increase to 120 million transfer for this year being asked for, 177 million projected on next year.
Thank you, Honourable Member. I will invite the Executive Chair and the Executive Director of Financial Services, QEH, to be able to respond to you. But I can say that from the Ministry's perspective that we are very happy that there have been some efficiency gains at the QEH, and they have implemented a number of systems that are working very well. And we at Central Ministry, we are looking to have discussions with the QEH to even see what we can borrow in terms of our institutions, public health care institutions. QEH.
Apologies. I'll let the Director of Financial Services speak first to the issue of the performance of the health levy, and I'll come back on to procurement.
Thank you. Good afternoon, Honorable Opposition Leader. I want to speak first of the health levy. We are, last financial year, the health levy was performing at about $5.11 million. After COVID, it's fallen to about $4.1 million. For next financial year, we are projecting about $50 million from the health levy. The QEH expects to generate approximately $3 million from its own private services. And we expect to have a budget of about $173 million for the next financial year. We expect that as the economy improves, that health levy will then increase back to approximately between 4.5 to 5 million at the latter end of the financial year.
Sir, could you please, it's a little late, but introduce yourself for our
Sorry,
purposes?
my
problem.
apologies. Adrian Hurley, Director of Financial Services, QEH.
Thank you.
The area of procurement certainly lends itself to areas that we've been able to make significant advance at the hospital over the last 3 years. I'll just itemize some of the initiatives that we have taken. We found an inventory system that was in need of automation, and we have created an automated inventory management system within the procurement department. We also took the step to move the procurement department into the finance department. It was operating as a separate entity and necessarily did not have the kind of financial controls. And within a few months of taking office, we achieved that objective that had been in discussion to bring our procurement under the auspices of the finance department. We also restructured the procurement department to bring improved leadership inviting, we have now at the QEH 2 chartered accountants and a procurement specialist who have been recruited within the past a year and a half to strengthen our practices. And we've also been looking at bringing all of our inventory into the procurement system. We found a situation where we have a lot of part-time purchasers, as we've called it, that have emerged over time because of how the hospital has operated, purchasing in the lab, purchasing in the operating theater, purchasing in the pharmacy. And what we've done is bring all of those systems into one and essentially created an expanded inventory list. We've also updated and reconciled our fixed assets register, which had been out of date since 2011, and this was a significant undertaking. We did that as part of our audit process, and we've able to do physical verification of the fixed assets, including inventory, during this initiative. We also have worked on improving the efficiencies within the department by creating and restructuring internally. If I can just have a moment to explain, we've separated the distribution, the warehousing and distribution function from the receiving function and from the purchasing function, creating 3 distinct departments that interrelate, but we're better able to monitor in terms of systems and controls. But you focus, Honorable Leader of the Opposition, on procurement, but there are other areas of wastage that we've had to tackle as an institution. And some of those areas involve making investments in equipment that would see us achieving savings. As an institution, part of the investment that the government would have made would have been to purchase a distilled water plant for about $175,000. Distilled water is used in the neonatal intensive care and in the ICUs, and is also used to mix certain medications. With the purchase of that distilled water plant, we are able to save $350,000 annually as an institution. We've also installed an oxygen plant purchased at $587,809. And as a result, we're able to save in the purchase of oxygen and the use of those very used green cylinders that people are comfortable with, $1 million annually in the purchase of oxygen. We've also seen the drive towards clean energy and renewable energy, and we're working with the Ministry of Energy on a solar PVC project that will see a reduction in our bill at the institution by $360,000 annually, and we're going a step further in partnership under the leadership of the Ministry of Finance at looking at how we can use solar energy more effectively to save costs and reduce that at the institution. We also, as part of our equipment purchases, have purchased a low steam sterilizer for our central sterilization department. And as you're aware, we would have upgraded the central sterilization to the tune of $1.4 million. This one piece of equipment, Honorable Leader, will reduce our bill by 55% for the outsourcing of low steam items such as medical equipment that need low steam sterilization. So I want to flag that we have made significant progress in how we've been approaching wastage as an institution, both in terms of capital investments to be able to save costs, and also in terms of reorganization of our procurement systems so that we can have better financial control and improve management of that area of the hospital.
Honorable Member for St. Lucie.
Thank you, Madam Chair. And if I had to be the 100th person to congratulate the Minister and his team for an excellent job they have done across Barbados, not just in terms of the COVID, that is of particular note, but generally in terms of our healthcare system, we are really making some progress. My intervention is to just ask a couple of questions and a couple of updates and seek an update really. I'm sure that my neighbor from the north, who is also to my right, would be interested in this particular question as well. We have had the introduction of 24-hour services at the Gall Hill Polyclinic, and there is another one, Sir Winston Scott Polyclinic. We have had extension to some extent of the time at the Morris Bayer Polyclinic, which services the north. I would want to find out if there are any plans to make the Morris Bayer Polyclinic, which services our area, a 24-hour polyclinic, and thus obviously increasing services and so on, and if so, how soon? I'm also concerned, my second question is to have an update on what is happening with respect to the A&E project at the hospital. We know we would have done a lot of expansion there, so I would be interested to know where we are with that. And also, you have experienced over the years nursing shortages of beds. There have been long wait which persons have had to have with respect to surgeries and etc. I want to know what are and where are we with these particular issues.
Okay, I know the question on the A&E was already answered, so brevity on that, and you may continue, Honorable Minister.
Thank you for your guidance, Madam Chair, as usual. The 24-hour plan, at this point in time, we only considered 2 polyclinics because obviously this is driven by available resources and funding. A 24-hour service requires additional personnel and additional supplies and everything, and so we are working within the parameters of what have been provided, but perhaps in the future, and they can't say when, this may be a possibility, but at this point in time, it's the 2 polyclinics only that I have mentioned. And I'll now turn over to the QEH in relation to the other questions.
Dr. Williams will speak on the work that we've been doing to improve the delivery of surgeries on behalf of the Office of the DMS.
Yes, please. We are actively trying to decrease the wait list for some of our elective surgeries, but as you would appreciate, we are currently on emergencies and time-sensitive urgencies at this time in the advent of community spread for COVID, because we are trying to conserve some of our resources. One of the things we've asked for were additional anesthetists, because we recognize the theater time is limited due to manpower issues. We do not have enough anesthetists or specialist nurses to conduct an extended hours operating list times. In addition to that, we are working on trying to improve the number of actual operating theater spaces that we have so that we can conduct additional surgeries as we try to decrease incrementally some of the specialist operations and procedures that will need to be done. The long waits are mainly for, as was mentioned before, the screening for colonoscopies, cataract surgeries, as well as the hernias and other non-urgent procedures. And we are trying aggressively to work on a campaign as early as this financial year to decrease some of these wait lists.
Can I also add additionally, Minister, with your craving your indulgence? Part of the delays associated with surgeries is that we have found that sometimes the readiness of patients is not always optimal. So one of the recommendations that has come from the Department of Anesthesia is the creation of a pre-op clinic where in advance of surgeries, the anesthesiologist can have do an assessment and make sure that patients are optimized. And when the day of surgery arrives, there are no delays associated with the patient's inability to take the care. We also have to achieve some efficiency. COVID has slowed down. We have to do more detailed cleaning and servicing of our theaters in between cases. But ultimately we've done our own internal research, which allows us to know, this was done by Dr. Sherry Lashley and the team in the Department of Anesthesia, which has really allowed us to see exactly where we have bottlenecks, which specific surgical teams are working optimally, and what are the actual causes of some of the delay. That kind of critical data we're using to make targeted interventions where they need to be. So where we need to have efficiency in our orderly service, people moving more efficiently from the wards to the theater, we're able to target them. Where we need to have people arriving earlier so that they can start their list earlier, we need to target that. And we're not going to take a broad brush approach. We're going to focus in on the individuals and the teams. But ultimately, what we have is very strong commitment from Dr. Sally Griffith, Dr. John Gill, and the team from the Department of Surgery to really redouble their efforts in this regard. And our ophthalmology department has given us that undertaking that the reduction of waiting times in cataracts will be reduced, and we're looking to bring back a small ward bed, C2, the old C2 ward, which is now basically been demobilized and is part of our services expansion of the A&E. We're looking to bring that ward C2 back into operation so that our ophthalmology department can increase the number of same-day cases that they're able to do. So this is all planned in our program of work for this year, and I look forward, Minister, Representative for St. Lucie, to being able to show the returns on that investment.
Honorable Member for St. Michael Northwest.
Thank you, Madam Chair. Blessed good afternoon to all. I crave your indulgence, ma'am, as well to extend congratulations to the goodly minister for an excellent performance so far as Minister of Health and Wellness. To you and your team. I just have one question, ma'am, and it has to do with a few of my constituents who have complained to me on numerous occasions in relation to when it comes to filling prescriptions at the polyclinic, and sometimes when they have to go for repeats and a particular drug is out of stock. Let's say that another polyclinic may have that particular drug in stock, but they are not allowed to go to the other polyclinic. So I was just wondering if a situation like that, if measures or a system could be put in place to help rectify something like that.
I am not on the team, but I am aware that the patient can go to another polyclinic once they have the prescription, not so much the repeats. So it'll be a matter of rewriting the prescription, but I hand over to the minister.
Okay. But like I said, once the prescription is filled at one polyclinic, so you're not allowed to get the drug from elsewhere.
Honorable Minister.
Thank you. Thank you, Honorable Member. Thank you, Madam Chair, for your assistance once again. But I would like to invite Dr. Marion Hines to respond, Director, Barbados Drug Service.
Good afternoon. Early on, I said I was Mariam Hines, Director of Drug Service. I'm still Mariam Hines, and I'm still the Director of the Barbados Drug Service, I think. Yes, it is true. It is possible when it comes to a repeat prescription because we do not have a wide area networking. And ideally, if we had the kind of resources that we have where we can make calls and check with the other pharmacy and so on, we would have been able to try to accommodate when there are repeats. Yes, when there is a repeat, there is a challenge, but I would like to say that we had incidents within recent times where two polyclinics, the pharmacy, once it was just the pharmacy, in another case, it was the whole polyclinic that were unable to function because of COVID-19 impacting on our staff. In those cases, we were able to, through MedData, be able to have physicians, medical records, be able to read what the prescriptions were from those other clinics and write it over so that the patients can access their medications at where they are. As you would appreciate, that would be very time consuming and that would be difficult, but suffice it to say that we are working on it. We are working on having wide area networking. We are hoping that with the new director of IT that we have, I would like to say that we would have resolved that problem if it were not for COVID-19. But of course, all the attention of the IT personnel went into COVID-19 and so many other things. But it's things that we've been working on. As a matter of fact, one of the lead IT persons to work with us on that has indicated to me that from next week, he will be available, have discharge of most of his duties with the COVID-19. So it is work in progress. We are working on it. And soon from now, patients would be able to access their medication from whichever polyclinic of their choice once we have achieved the wide area networking and we can be able to access patient data. So the challenge is in being able to access the data of the patient.
Thank you very much.
Honorable Member for St. Michael South Central.
Thanks, Madam Chair, for acknowledging me a second time. I will try to be quick. Now, the matter of, well, disease control, I know that when it comes to vector control, vector-borne diseases, that there are plans to be able to do more research and documentation in terms of our response to dengue and so on as part of your expanded lab work. But my first question is about overall infectious disease capacity. The entire country watched the country's response to COVID-19. Dr. Ford led the charge, and along with the team at Harrison's Point, Dr. Ford, Mrs. Rowe, I have to acknowledge on the operations management side. But the truth is that this was all very difficult. It was unprecedented. It was not just HP. It wasn't just isolation and quarantine facilities that we originally stood up, but then others that had to be stood up, hotels that also had to be stood up. Barbados' response was quite unique. Here's my question. One, is this pandemic response being documented officially so that we see that what the blueprint has been, so that, you know, whether it might be on a smaller scale in the future or in another jurisdiction that might want to learn, is this being documented? I think that's important. But then also, how are we building out infectious disease capacity? We said, a lot of what we said was about the fact that Dr. Ford perhaps was unique in having been trained. I think there are one or two other medical professionals that have also been trained in this area. But I'm hoping that we're not thinking, well, since this is a 1 in 100 event, we don't have to make sure that we build out the capacity and learn from this. So that's the question I have. The second very quick one comes back to the A&E expansion, which I'm happy to hear will be operational from next month. But I want to ask, how do we expect improvements? What improvements do we expect in terms of wait times and quality of care at A&E? Are we measuring that? Do we have targets on that? to say we want to reduce the wait time from X to Y, so that we can actually see how this expansion is affecting people in real terms.
So, Honorable Member, there's no doubt at all that we need to expand our infection control capacity, and not only for COVID, but generally speaking, because we are responsible for several healthcare institutions, hospitals, at all levels, and this is a necessity for us going forward outside of COVID. Documenting COVID, this is something that we've discussed at the Health EOC, and I recall that we would have tasked one of our officers to lead this effort, and it had to do, to a large extent, with the fact that we have to leave something for those who follow us, so that there is a blueprint, so that they don't have to start from scratch in the same way that as Minister of Health and this team, we didn't have to start from scratch because we had something that was there from the SARS outbreak and even Ebola that we were able to utilize, and that gave us a good head start. And so we need to be able to do that now. And because of the extended nature of this pandemic, this is something that we take very seriously, and we have to be able to leave that behind and to give a small island state perspective as to how we've been able to handle this, and not only from the health perspective, but the all of society, all of government approach that was taken. I will invite the QAH, but before I do so, to respond in relation to the accident and emergency. I can say beyond a shadow of a doubt that even before this construction commenced, that with the measures that they adopted with the short stay unit, etc., and also the impact of the Winston Scott 24-hour service, that significantly reduced waiting times at QAH. And I recall one day, Director Bob sent me a photograph or two. I couldn't believe the empty chairs that I saw at accident and emergency. This was pre-COVID, of course. So yes, I believe that there's been a reduction, and I know that the QAH will be able to give further explanation.
Thank you very much, Minister, and thank you for that question, Minister Cattle. I will only add in terms of that was documenting or sharing what we've been able to experience. I've had the opportunity to pique the interest of the Clinton Foundation and had discussions with Chelsea Clinton and the Clinton Foundation, where we were able to share the Barbados national experience and what we were able to do here in Barbados and showcase that across the globe. That has been followed on by Dr. Angela Jennings and others, showcasing and drilling down on what we were doing in areas of pediatric services. So it is important to showcase and document in the various forum what we've been able to achieve here in Barbados with our COVID response, and we have been seeking to do that, but I would agree that it needs to be more systematic. In terms of building out the capacity for infection control, I'd like to add to the minister's statement that we've had specific discussions within the last 2 weeks with Dr. Guibre of the PWR of the PAHO based here in Barbados, and we're looking to roll out a training program across the QEH to really strengthen the depth of our capacity in infection control, not just at the physician level, but across the level, have more linked nurses, and really have more people who are involved in infectious diseases. Infectious disease and infectious disease control is more than COVID. It goes back to MRSA, it goes down to antimicrobial stewardship and other initiatives that really showcase what is required for maintaining patient safety at the hospital. And so we're going to be working with PAHO on strengthening that at the institution. And we're hoping in the 21 financial year to identify another physician level fellowship that we can have someone in addition to Dr. Corey Ford, who can be also a specialist in infectious diseases for the institution. or Dr. Shani Williams is also an AED consultant and very well versed in how the new facility will improve services, and I'm going to let her speak with more specificity in that regard.
Yes, we're planning to just improve on the metrics that we would have set for ourselves over the years. We measure everything we do every step of the way, from the time the patient arrives, from the time they're assessed, the time they see the doctor, the decisions to admit, and the time they actually go to the medical unit or inpatient services. So the patients who may present to our emergency department have varying degrees of morbidity. So of course the waiting time will be varied. Some may have to wait longer periods of time, and that's why we would have instituted the short stay unit. For example, persons with chest pain may need a series of interventions before a decision is made whether they continue their care as inpatients or follow up as outpatients. And similarly, the minor cases unit was a strategy that we put in place for those persons who did not meet the criteria to be referred on to the 24-hour polyclinic services because they may have needed further interventions or procedures to be done. Those types of patients would be fast-tracked to that service in the new expansion so that their wait time will be less. And those patients who present with minor complaints will be diverted away from the emergency department after the initial assessment to the 24-hour polyclinic so that they can continue their care and treatment in a timely manner. And some of the metrics we would have set ourselves is to significantly decrease the door to what we would call triage or assessment time. Initially it was as much as 45 minutes. We want to decrease that in half. The door to doctor time, we would have seen, again, the initial triage assessment will front load some of the interventions. So on assessment, you may go straight to CAT scan, get your pain medication, get other interventions. So that is or when we had Asthma Bay fully functioning, they would go to the Asthma Bay section to receive their treatment. That is our care and treatment intervention that we should also celebrate as successes to the initial contribution to your ongoing care and treatment, but not well recognized. So the door-to-doctor time, we also want to significantly improve on that, and it will obviously depend on the severity of illness. Or persons who are in extremis are seen immediately, and so on. We have metrics for the other categories that we would have determined on assessment. And then finally, we want to decrease the times when patients leave without completing their care. So for one reason or another, persons may decide that they want to go and seek care elsewhere. That is their choice after the initial assessment, but we don't want people to what we will call leave without treatment or leave against medical advice. And that is measured, and we would like that to be less than 10% of our population of our clients that we see.
Thank you. Reminding members, we have 5 minutes, which includes the minister's wrap-up. I invite the honourable member for Christchurch South.
Thank you very much, Madam Chair of Committees. Please be assured that I'll be very, very brief. If the clerk of the Parliament mistakenly thought that I was asleep, I want to assure you, ma'am, that I was not asleep. I was deep in thought, trying to remember when I came to this Parliament and promised the people of Christchurch and Oistins that the Randall Phillips Polyclinic would go to 24 hours. And I've heard the minister's explanation that it is a question of resource limitation. Now, I want to be in a position to congratulate this minister. I understand what he is saying to us. I want to be in a position to do that, certainly in relation to the Randall Phillips Polyclinic becoming a 24-hour operation, and to seek to persuade this minister that there is that need to locate a minor emergency facility in the south of Barbados, and that Oistins is that ideal place. Not only is it a commercial center, but it serves a large part of Barbados, which is residential and densely residential. So I want to invite the minister to say to this Parliament and to say to the people of Barbados, if those plans that were made in 2018, in my first speech in this Parliament, I promised the people of Oistins, by way of congratulating the minister, that the Randall Phillips Polyclinic would have been 24 hours. And I made that promise further to a promise made by this minister. I want to urge the minister to reconsider, when the resources become available, that the Randall Phillips Polyclinic is well ready to become a 24-hour operation. May I have your comment, Mr. Minister? Thank you.
Thank you very much, Honourable Member. You would recall that when we assumed office, that Randall Phillips was indeed selected to be the location of one of the 2 24-hour services. And that selection, I believe, was made based on exactly the things that you just outlined. However, I toured the polyclinics in the early stages, and together with the team at the Ministry of Health and Wellness, and in consultation with the team at the Randall Phillips Polyclinic, we determined that the polyclinic did not have the space, the capacity, whatever you're looking at, to be able to utilize that as a 24-hour polyclinic. That's one. And that when we visited St. John, we recognized that St. John was ready to become a 24-hour service because of the facilities there. We also recognize too that, and we've not forgotten the need to have one in the south for the reasons that you outlined, but the facility, there's a plan to relocate that facility at some point in time to the other side of the road, I believe. I had some discussions with the Ministry of Economic Affairs and Investments, and I would say that at that time that can be considered. But at this point in time, there's not enough space, and the layout at the Randall Phillips Polyclinic did not lend itself to what we wanted to do with the 24-hour service.
Thank you very much.
Honourable Member for St. Thomas, you have a few minutes to make your intervention.
Be very brief, ma'am. I want you for acknowledging me in this respect, but I did not feel comfortable to leave here today without drawing to the Ministry of Health's attention the level of trepidation, the fear, the uneasiness, the doubt of thousands of poor people in Barbados, and the treatment that they sometimes meet, just a small percentage. I want to find out what plans there are for public relations with the staff at the hospital so that people can come feeling more relaxed and a little more comfortable in the environments they are in. Some say to me, I feel as though I'm literally begging. And I go undercover and I see treatment that should not be. And despite the excellent role that he has been playing, those small 2% of it turn away ordinary people. I am asking to find out what level of training or public relations exposure is being extended to the folks. I'm not going to deal with the other part on ophthalmology. The only other final thing I wanted to say is that too many poor people cannot afford to have surgery for fibroids. And if that had been mentioned before, I want to apologize for mentioning it, but I believe that people calling and having appointments held, and then when they get to the hospital, the consultant or whichever term it is that's used, the person can't be there. And sometimes for 4 and 5 and 6 and 7 years, there are poor women in particular moving around with fibroids that they can't get any help. And because of the limited resources in families or none at all, they are suffering. I would like to know what plans there are to help to mitigate that aspect of it as well, ma'am. Thank you.
Honourable Member, I would love to see you undercover, if it's possible. I don't see you walking into a polyclinic and no one knows you.
I did it last month and I was shamed.
Brilliant.
I'm extremely disappointed because I used the address of the old man whom I took.
Okay.
I said I'm his neighbor. Thanks.
Honourable Minister.
Thank you, Honourable Member. Already, thank you. I would allow the QEH to deal with the surgeries that you mentioned, and in the interest of time, I will take the question on the how we interact with the public and customer service. And I'm taking it because within the first couple months of assuming office as Minister of Health and Wellness, I would have spoken to this issue at the Queen Elizabeth Hospital at the end of a tour I had there, and I would have charged not only the QEH, but all healthcare facilities in this country to understand that the need and the importance of relating in a civil manner to the public to which we serve. I would also have indicated then, and I still do so now, that it is a tourist street, and I had also asked for Barbadians to show some love and respect for the healthcare persons working within these institutions. And I believe if we can get the two of those things going together, that we will see some improvement. We must see some improvement, but there are some things that we have to do at the level of the ministry and the level of the Queen Elizabeth Hospital, and I know that that has been happening there in order to improve and enhance that relationship with the public that we serve. And we, for example, started to take some steps within some of the polyclinics in relation to Wi-Fi access and things, and to embrace people and how we respond to people. But there will always be an element in whatever ministry and whatever institution that will not always operate to the level that is expected, and that is something that we too have to deal with, QEH.
Thank you, Minister. You're correct. In addition to hernias, cataract, we have included the issue of fibroids and other illnesses associated with women's sexual and reproductive health. So that has been included because there have been some delays in accessing care for those services. I think it is a matter of how some of these services are categorized. That very often fibroids and those kinds of services are not categorized as absolute emergencies by the medical professionals, but for women, for us women who are impacted by them, we know the level of discomfort and disability that is caused as a result of not being able to have treatment in this regard. So certainly I am an advocate for this, and this has been included. I just want to add, in addition to the minister's comments, that we have for the first time established a patient empowerment committee, and we're going to have the chair of that committee established as a full-time and support someone to be full-time involved in engaging and advocating for patients. We also are going to be having an application that patients can, in their beds, in real time, and families get access directly to the office of the DMS clinical risk departments and give direct feedback and raise queries and questions directly to administrators, so we can be aware of what is happening and improve the level of clinical accountability. I've mentioned earlier about training, and lastly, we have included in our estimates doing additional public relations support, because as the minister said, it works both ways. Us doing better in terms of our patients, but certainly if you speak to the team in the accident and emergency and outpatients, there is also an element of significant abuse that's faced by the staff as well, and we have a zero tolerance for that. So we're working in these areas. Thank you.
Executive Chair, does that include joint replacement? Because I've known patients waiting on the list for years.
Joint replacements is an extremely costly exercise. We have not taken it is something that we have to address. We do not now have it as part of our estimates because of the costs that are involved, but it is certainly something that we recognize we have to look at. Knee replacement and hip replacement. We have those areas that we need to work on. We're only able to do a few because of the cost of the kits that are involved, and we do have some that we've had to outsource to the medical aid scheme.
Okay. Honourable Minister, we invite your wrap up.
Thank you very much, Madam Chair. This will be very short. I simply would like on behalf of this entire team, on my own behalf, to thank you first of all for helping us to navigate this process for the last 3.5 hours or so, and to thank all honorable members for their questions, their comments, and their contributions. There's some things that we definitely will take away from here that will help us to improve on our delivery for the next financial year. And finally, one of the legacies of COVID for me, and I am challenging this ministry, is that we must set the example for the remainder of this country as to how we must continue to deliver and improve the services that we are providing, even in the midst of COVID, because we need to demonstrate that it is absolutely important as individuals and collectively as institutions, ministries, companies, whatever, that we must learn to work with COVID, to work around COVID where necessary, but we must continue to deliver. And with those few words, I would like to beg that Head 86, in the name of the Ministry of Health and Wellness, and in the sum of $252 million, do now pass.
Not pass, I'll pose a question.
Thank you.
Head 86, in the amount of $252,191,015 stand par as amended. All honorable members in favor, please say aye. All those against, please say nay. Methinks the ayes have it. Your mic as usual.
Madam Chair, I beg to move that you do now report to His Honor the Speaker progress and ask leave to sit again.
The question is that I do now report to His Honor the Speaker progress and ask for leave to sit again. All honorable members in favor, please say aye. All those against, please say nay. Methinks the ayes have it. You got me. Neil will sit. Neil may have to sit. Sure.
Chairman of committees has reported progress and requested leave to sit again. Honorable Leader, Government Business. I ain't going to talk about the mic again, Honorable Member. Don't have to, but apparently you do. Please put on the mic, sir. Thank you.
Mr. Speaker, I beg to move that we take a break for lunch at this time, and therefore that this House be suspended until 3:30 in the afternoon.
I had to second that, sir.
Question is that this honorable chairman be suspended until 3:30 p.m. 3:30? As in 3:30? Half past 3, sir. Correct?
Only on Fridays.
Only on Fridays. The question is that this honorable chairman be suspended until 3:30. All those honorable members in favor, please say aye. Those against, please say no. Meeting the ayes have it. This honorable chairman stands suspended until 3:30 p.m.